Welcome back everyone. Good afternoon. We are going to go live with the PSM LRR today, and in this session I'm going to present to you all the PYTs of PSM that are extremely important for your FMGE exams, and these PYTs are not just from FMGE exams but they are also from NEET PG guys. So it's going to be a concise, crisp revision of everything that we have learned so far. Okay? All right. Is the voice now audible? Am I audible now? Not so far. Okay. Okay. So let us begin with the session without taking too much of your time, everybody. So let us go and start with the session now. All right. So as you can see, everyone, the first question over here, the first question over here is a person going for now I'll mute karo. Okay, so let's start with the first question, guys. So the first question over here is a person is going for self-health checkup to a hospital as his father died last week due to ischemia. Which level of prevention is this? All right. So now if you see over here, the father has died and the person is going for a self-health checkup. Now levels of prevention question you will definitely expect in your exams, guys. So levels of prevention we all know levels of prevention. If you talk about levels of prevention, there's primordial, there's primary, there's secondary, there's tertiary. ठीक है? Now primordial क्या होता है? Before risk factors. Primordial छोड़ते हैं. Primordial क्या होता है? Before risk factors is applied. Okay. Primary क्या होता है? Once risk factors is present but disease has not started. Secondary क्या होता है? Disease has started. Okay, but it is still reversible. And what is tertiary? It prevents the whatever complications has occurred. Now the disease is irreversible. So over here I've told you many times, guys, self-health checkup is a form to make an early diagnosis. It is a form to make what? Early diagnosis. So what is this level of prevention? This is an example of secondary level of prevention. All right. This is an example of secondary level of prevention. Please don't mark it as primary. Any form where we're going to do a checkup, guys, to make an early diagnosis. It is which level of prevention? Secondary. Now in the exam, if you get pap smear, in the exam, if you get breast self-examination, mammography, school health checkup, anything that you get, annual health checkup, anything that you get, all of this is which level of prevention? Secondary level of prevention. Screening, very good. Screening comes under which level of prevention? It comes under secondary level of prevention. Okay? So don't get confused with these terms. But agar question aata vaccination, guys, agar question aata vaccination. Now what is vaccination? Vaccination is nothing but a primary level of prevention. It is specific protection. We give measles vaccine because the child does not as of now suffer from measles. तो हम लोग उसको measles की vaccine लगा रहे, but he is at risk of measles. But अगर exam में question आ गया BCG for treatment of bladder cancer, BCG for treatment of bladder cancer, guys. Now if you talk about treatment, what level of prevention it is? It is nothing but secondary level of prevention. Clear? But एग्जाम में अगर आता है डॉट्स, एग्जाम में अगर आता है MDT, एग्जाम में आता है लेट्स से ART, एनीथिंग, इफ द एग्जाम में आता है ACT, all these are methods of treatment. So what is this level of prevention again? Secondary level of prevention. Clear? Give me a thumbs up if you are clear with the levels of prevention wala question. Rahul, light off karna. Okay, if you're clear with the levels of prevention wala question, any form of health checkup is going to be your secondary level of prevention. So this we've done. Sorry, it got repeated 2 times. Okay. Now let's go to the next question. Which is one of the criteria which is used to define severe acute malnutrition according to WHO standards? Okay, severe acute malnutrition according to. What is primordial? Primordial level of prevention hota hai before risk factors. Do not drink, do not smoke. Okay, suppose मैं बोलूं कि If I say mosquito nets कौन सा level of prevention है everybody? If you talk about mosquito nets होता है primary level of prevention. But if we do not let water collect, okay, if we fill all the drains and ditches, filling all the drains and ditches, that becomes a primordial level of prevention. ठीक है? All right. Okay, let's go to the next question. Now, SAM criteria. Which one of the criteria is used to define SAM according to WHO? Now, if you talk about WHO ka SAM criteria, please remember severe acute malnutrition, mid upper arm circumference more than 115 millimeter? No. What should it be? It should be below 11.5 centimeters or below 115 millimeters. ठीक है? Next, what is weight for age? Z-score below -2? No, it's not weight for age. We are talking about acute malnutrition. तो ये क्या होता है? Low weight for height. Low weight for height. Now, low weight for height, if you talk about, it is low weight for height. Low weight for height. This should be below -3 ST. Weight for height, Z-score below -2? No, it is below -3 ST. So, what is the correct answer over here? Presence of nutritional edema. Okay, I hope all of you got this question correct. यहाँ पे -2 था guys. It's not -2. What should it be? It should be below -3 ST. Clear? Is it clear everyone? Okay. So we will go to TB questions. So I will be discussing TB as well. So there you can ask your doubts, active, passive. ठीक है? So let's move to the next question. Now all of you know mid upper arm circumference को measure करने के लिए कौन सा tape होता है? What is this tape guys? This is Shakir's tape. This is Shakir's tape. Now, if you talk about Shakir's tape over here, you have 3 color codings. ठीक है? Now, green क्या है? More than 12.5 centimeter, which is normal. 11.5 to 12.5 centimeter. Red is SAM. And SAM का presentation, guys, is 2. Kwashiorkor and marasmus. Please remember. Now, you will definitely be doing its differences in pediatrics. But if I ask you which is more serious, तो ज़्यादा serious क्या होता है? More serious is Kwashiorkor. But India में more common कौन सा है? More common everybody is marasmus. Clear? India में more common is marasmus. So you must know these basic things. And Shakir's tape, we measure mid upper arm circumference किस age से किस age group तक? Please remember 6 months to 5 years. Also one more thing, it is age independent assessment of malnutrition. Age independent criteria. Alright, age independent criteria. ठीक है? Give me a thumbs up. Everybody understood? Enjoying the session? It's a long session, pretty long session where I'll try to cover almost everything in PSM, which is important. So I want you to stay with me, enjoy the session, and PDF will be shared after the session. So please don't worry at all. ठीक है? आराम से relax होके पढ़ो, enjoy the subject. If you have any doubts, any queries, note it down, and towards the end of the session, 5-10 minutes, we can definitely devote to answering your doubts. चलो, let's go to the next question. 100% mortality for a disease, incidence and prevalence relationship will be. What is your answer over here? 100% mortality. 100% mortality for a disease. What is going to be the incidence and prevalence relationship? So यहाँ से मुझे आपको दो चीजें पढ़ानी थी. P is equal to I into D. Now P is equal to prevalence, I is equal to incidence into D क्या होता है? Duration. Now you all know that prevalence is going to increase if duration increases. That means if we are living longer with the disease. Incidence, if new cases increase, automatically they turn into old cases. यहाँ पे क्या लिख रहा है? The disease is 100% mortal. That means whoever suffers from the disease dies, guys. ठीक है? जिसको भी वो disease होता है वो मर जाता है, dies. So what happens to the D over here? D decreases. So what happens to the P over here? P decreases. But what is going to happen to the incidence? That is not going to get affected because incidence depends on the risk factors. So that's going to remain the same. So over here, what is your correct answer? P is less than I. Is it clear everybody? Prevalence क्या होगा? It's going to be less than incidence. Like suppose if I have a if I have launched a drug, okay, a drug क्या करता है? Drug cures the person. If the drug cures the person, what is going to happen to the prevalence? So we know that अगर कोई drug person को cure कर दे रहा है, what is going to happen to D guys if the person is getting cured? D will decrease, P will decrease, but incidence will remain the same. But suppose if there is a drug that prolongs survival, okay, it prolongs survival. It does not cure a person, but lets a person live longer with the disease. So what is going to happen? Like ART drugs, okay, P is equal to I into D. इसमें क्या होगा? D is going to increase, P is going to increase. But everywhere incidence will be the same. Incidence will decrease when we focus on the, incidence is going to decrease when we focus on what everybody? Incidence is going to decrease when we focus on the risk factors. Clear? Chalo, look over here, I have given you one statement also. In acute diseases, because of rapid recovery or death, prevalence will be relatively lower than incidence, and in chronic diseases, जैसे TB वगैरह, prevalence will be higher than incidence. This is just for your information. ठीक है? Now let's go to a numerical. So in today's lecture, I am also going to give you a lot of numericals to practice. We have almost 100 MCQs to do today, guys. जिसमें numericals आते रहेंगे in between. Now this is a numerical which came in the exam. So I want all of you to revise this with me. Question क्या कहता है? A community with a population of 10,000 had 100 existing cases of malaria on January 1, 2024. During this year, 30 patients were cured and 10 patients died. Additionally, 20 new malaria cases were reported, out of which 5 were cured before December 31, 2024. ठीक है? What is the incidence of TB at the end of the year and the prevalence of TB for the year? Number one rule to solve a numerical, please don't panic, घबराना नहीं, and don't think that I will be leaving out this numerical. No, please remember, हर एक question में it's not necessary that you will be taking 1 minute or 2 minutes, right? In some you will be able to answer within 10-20 seconds also. So you have the time to attempt the numericals. Now over here you have to find the incidence and the prevalence. ठीक है? So incidence क्या होता है? Incidence होता है, incidence is what? It is the total number of new cases of a disease, all right, that occur during a specified time period, that occurs during a specified time period out of the total population at risk, out of the total population at risk. And we all know incidence ka multiplier is 1000. And what is prevalence, everybody? What is prevalence? Prevalence hota hai total number of existing cases of a disease, total number of existing cases of a disease at a point of time out of the total population. ठीक है? The multiplier is 100. You don't have to worry about so many cured and so many died. Nothing at all. See, 100 existing cases were there. During the year, 30 were cured and 10 died. Please don't worry about them. Additionally, 20 new malaria cases were reported, out of which 5 were cured. You don't have to worry about that as well. You have to find what is the incidence of TB. So, what is the incidence of TB over here, guys? So, if you see over here, incidence kya hai? Like we discussed, number of new cases of a disease. So, how many new cases got reported? 20. Alright, कितना population है? 10,000. Multiply कर लो 1000 से. कितना आ गया answer? 2 per 1000. Now what is the prevalence? Prevalence is number of cases, all cases of a disease at a given point of time. So during the beginning, we had 100 existing cases, right? And then 20 new cases also occurred. So prevalence में क्या होता है? It is existing cases. Existing cases मतलब क्या होता है? New plus old. So you have added what? 100 plus 20 divided by 10,000. Okay. Now, because the question over here expressed in 1000, we have to express in the form of 1000. Otherwise, you really don't have to worry कि मैम आंसर तो आप हमेशा बोलते हो 100 में होता है. होता 100 में, but क्योंकि ऑप्शंस में 1000 में दिया गया था एग्जाम में, so we'll keep it that way. So if you solve it, what is the answer comes to? The answer comes to 2 per 1000. and 12 per 1000. Moral of the story, listen to this very carefully. Hamesha, every time it's not necessary that all the values would be, all the numbers would be used up in a numerical. कभी कभी नहीं भी use हो सकते हैं, ठीक है? So you don't have to worry about 5 were cured and 10 died. You just have to know incidence is new cases, prevalence is the existing cases. Is it clear? Give me a thumbs up if you got this into your head. Every student in the class has to keep giving me thumbs up in between. तब मेरे को समझ आता है ना कि तुम्हें समझ आ रहा है, and then we get to enjoy the session as well, okay? So give me a thumbs up everybody, okay? We don't have to detect the cured cases. It has nothing to do with incidence and prevalence, okay, right now in this question. Okay, let's go to the next question. Now we come to epidemiology. Let's see if you can mark this answer, guys. A person wants to study about relationship between smoking and lung cancer. So he collects data about people diseased with lung cancer from government hospitals and the number of cigarettes packets sold at the same time period. What type of study design is this? So what is your answer over here? What type of study design is this? देखो मैं बहुत ही simple तरीके में आपको सिंपल क्वेश्चन दे भी सकती हूँ दैट रिलेटिव रिस्क इज कैलकुलेटेड फ्रॉम विच स्टडी डिजाइन, बट नो, नाउ हाउ द क्वेश्चंस कम, दे विल गिव यू एन एग्जांपल, फ्रॉम दैट यू हैव टू फाइंड आउट दैट ओके दिस इज this particular study design and accordingly solve your question. So I'll try to present the approach that we have revised in our RRs, in our classes. How do we simplify the approach? Okay, now यहाँ पे दो चीजें थी guys. You're getting over here same time period. Now what is the buzzword over here? Same time period. Same time period में दो तरीके की studies हो सकती हैं. What are the two studies that can occur in the same time period? I hope you remember cross-sectional study, and what is the other one, guys? Ecological study. Okay, cross-sectional and ecological. Now what is the difference? In cross-sectional study we rely on primary data. Primary data का मतलब क्या होता है? I will go and collect the data myself. But in ecological study we rely on which data, everybody? Secondary data. Secondary data मतलब the data which has already been collected. So over here you can very well see relationship. That means we are studying the association, but the data that we are picking up is from government hospitals. So this is which type of data, everybody? Secondary data. So same point of time, secondary data. What is it? Ecological. Why is it not cross-sectional? Because in that we rely on primary data. Why is it not experimental? There is no intervention as such happening over here. Why is it there? No, it's not a cohort because it is not a follow-up study. ठीक है, हर एक स्टडी डिजाइन का आई विल गिव यू एन एग्जाम्पल कि तुम एग्जाम में हाउ आर यू गोइंग टू आइडेंटिफाई व्हाट शुड बी योर बज़वर्ड्स. अदर देन दिस आई वांट अ वेरी क्विक आंसर. यूनिट ऑफ स्टडी इन इकोलॉजिकल स्टडी डिजाइन क्या होता है? यूनिट ऑफ स्टडी इन इकोलॉजिकल स्टडी डिजाइन, इज इट इंडिविजुअल और इज इट पॉपुलेशन, गाइज? व्हाट इज द यूनिट ऑफ स्टडी इन इकोलॉजिकल स्टडी डिजाइन? आई होप यू ऑल रिमेंबर इट इज पॉपुलेशन. और अगर एग्जाम में क्वेश्चन लिखा हुआ आया the study is being done in Delhi, Noida or UK, Canada, ये सब आपको किसका hint देगा? It is going to give you a hint at ecological study design. ठीक है? Clear? So please don't forget these points. This is very important. Now this was the image of ecological study design which we have done before also, so we are not going to do it in a lot of this thing, but this represents ecological study. और यहाँ पे ये कौन सा image है? This is scatter diagram. This is scatter diagram. Clear? Chalo, let's move to the next question, guys. Let's move to the next question. So the question over here is, residents of 3 villages with 3 different types of water supply were asked to participate in a study to identify cholera carriers. Because several cholera deaths have occurred in the past, virtually everyone present at the time submitted to the examination. The proportion of residents. So what is the answer over here? Anyone can tell me what is the answer over here? Just give me one moment, please. Yeah, what is the answer over here, everybody? What is the answer over here? So if you see the question over here, the question says everyone at the time. That means it is again being conducted at the same point of time, guys. And what is being done? Proportion. Proportion का मतलब क्या होता है, guys? Percentage. So everyone at the same point of time, and we are looking at the proportion. Proportion means what? Percentage. So which is the type of study design that we are referring to over here? Cross sectional. Proportion का मतलब होता है prevalence, and this becomes what? This becomes a cross sectional study design. It is definitely not case control, because case control में एक group को you divide into diseased, non-diseased. Here we have 3 different groups, guys. At the same time, we can go to all the 3 groups to identify the cholera carriers. So this is what? A cross-sectional study design. And what does cross-sectional study design help you calculate, everyone? Cross-sectional study design आपको क्या determine करके देता है? Prevalence. Okay, prevalence is calculated from a cross-sectional study design. Now let us look at the next question. What is the answer to this? A study to determine the association. All right, let's go to the next one. A study to determine the association between maternal smoking histories from pregnant women during their antenatal visits and subsequently assessing the birth weight of the babies soon after delivery. Now, always remember, I have told you in the approach also, you have to first identify what is the exposure, what is the outcome. तो question में आप सबसे पहले देखोगे exposure क्या है and outcome क्या है. So, exposure over here is again smoking, and what is the outcome that we are going to assess over here? So we are going to assess the outcome as low birth weight. ठीक है, अब यहाँ पे confuse मत होना. Don't get confused that ma'am has said that whenever you look for a buzzword, if you see the word history, it means going backwards. But here, what is the most important word? Subsequently assessing the birth weights of the babies. So that means you have women who have come to you during ANC visits. You divide them into smokers and you divide them into what, everyone? Non-smokers. And then you are moving forward with time to see कितने women के babies low birth weight होंगे, कितने के no low birth weight. Low birth weight, no low birth weight. So what is it that you're comparing? You're still comparing what? Exposed, non-exposed. Whenever you compare exposed, non-exposed, it is cohort. And how do you know which type of cohort it is? You're moving forward with time, along with time. So this is what? A concurrent cohort, or you will call it as a prospective cohort. It is also known as, everybody, longitudinal cohort. It is also known as longitudinal cohort. Please remember, whenever we compare exposed, non-exposed, it is always known as a cohort. ठीक है, so here you were moving forward with time. The buzzword over here was subsequently assessing, or we could also say follow up with time. ठीक है, now look at the next question. The question that came in NEET PG 2023 and again got repeated in your FMGE exams, the last one, 2025. So what is this one? Can anyone figure out what is the answer to this, guys? Next question में देखो, a study is being conducted to find the association between aniline dye exposure and bladder cancer among workers who have worked in the factory for over 20 years. ठीक है, for the study purpose, two groups are formed. One group directly handling dyes and the other groups involving office workers not directly exposed to dyes. Years of occupation including other exposure details were collected by examining the past records. Now, देखो, I am not saying that the same question might come in the exam. It can. But what is the topic that we have to master? Approach. How to identify the study design, everyone. That's what is important over here. Number one, you have to always identify exposure and outcome. So everyone knows कि यहाँ पे dye is the exposure. ठीक है, dye exposure है. और तुम्हारा outcome क्या है, guys? The outcome over here is bladder cancer. The outcome is bladder cancer. Now, any buzzword that you see, past records. Now, I've told you many times, Past records is a hint at retrospective. Okay, that means we are going backwards. Now, if we go backwards, we can also have a case control. But for case control, there is always comparison of cases and controls. यहाँ पे क्या हो रहा है? Very clearly the question has written one group directly handling dyes. That means you have one group, you have, okay, what is happening over here? You have one group which is exposed to the dyes and the other group which is no dyes, and then we are moving forward in time to look at the bladder cancer. So what is this type of study design, everybody? Retrospective cohort. Now why is it not why is it not a cross-section? Why is it not a case control? Why is it not a case control? It is not a case control because what is my comparison group? My comparison group everybody here is exposed, non-exposed. Now, if you remember, we had done these two images in class also. Exactly ये वाला image है इस question का. Next time they can give you the image. What is happening over here? You start at the present time, you go back. From the past records, you divide tire makers, staff, that means dye makers हो गया, clerical staff हो गया. So what are you comparing, guys? Exposed, non-exposed. At the present time, you're looking at the outcome. So definitely this is a follow-up study, everybody. Definitely this is a follow-up study. But what have we done? We have saved time, we've saved money. How have we saved time and saved money? By going backwards. So this, everyone, is a retrospective cohort. Retrospective cohort, ठीक है. और यहाँ पे क्या हो रहा है? You start the study, you divide into obesity and lean. Okay, you divide into obesity and lean, and then what you're doing, you're coming forward to look at the incidence of disease. This is what, everyone, a prospective cohort. So remember one thing, cohort में comparison is always exposed, non-exposed. If you go backwards and take that data from past records, that's your buzzwords, that's a retrospective cohort. But दोनों ही क्या है? एक follow-up study है. Am I clear? Okay, but look at the next question. It's a slightly bigger question, but I hope you will be able to answer this question. It's slightly bigger, but I hope you will be able to answer. So can you try out this question, everyone? Can you try out this question and tell me what is the answer to this question, guys? What is the answer to this question? A 3-month-old baby. Guys, just give me one moment, please. Okay, now let's do this question. So what is the answer over here? So the answer over here is, yeah, now I can see your messages. Okay. अब यहाँ पे buzzword क्या है? देखो, don't worry by the length of the question. It's just to make you revise your concept, okay? A 3-month-old boy is brought to the emergency department by his parents after an episode of cyanosis and muscle hypotonia that resolved after 2 minutes. Diagnostic evaluation क्या किया है? Diagnostic evaluation fails to discover an exact reason. All this is story. Look at this. The risk profile for bruit remains unknown. Pediatrician who saw the boy is trying to identify risk factors for bruit. She is aware of several confounders, including so many things. She recruits 75 infants under 1 year of age with bruit and this without bruit. All right. So this we have to look at. She then compares the two groups with regard to history of feeding problems and history of URTI. So now you know bruit. Bruit is something which is rare. For rare diseases, what is the choice, everybody? Case control. And over here, it is clearly written that we have two groups, infants with bruit and no bruit. And we are going to look at, we are going to take a history, we are going to interview their mothers to know about what could be the possible reasons. So this is which type of study design? Case control. अब case control में कैसे confounders हटाते हो? Matching से हटाते हो. So you should know about this. Case control में कैसे confounders हटाते हैं? Matching. Matching eliminates only which confounders? Matching eliminates only the known confounders. Okay. Matching eliminates only the known confounders. राहुल इसमें वाईफाई लगा के दे दो तो. Matching eliminates what? Matching eliminates only the known confounders. So you should remember this. Blinding किसके लिए होता है? Bias के लिए होता है. And what does randomization do? It eliminates both known and unknown confounders. It eliminates both known and unknown confounders. So what is the moral of this story? Moral of this story is that when you have to compare exposed, non-exposed, कौन सा group होगा? It is going to be a cohort, but when you have to compare diseased, non-diseased and take an interview, it is a case control. ठीक है? Can you give me a thumbs up over here, everybody? See, this is a case control study design. Case control में आप किसको compare करते हो? Cases and controls. You go back and look at the factor present and factor absent. But when it is a retrospective cohort study, when it is a retrospective cohort study, आप क्या करते हो? When it is a retrospective cohort, you go back, you look at the past records, compare exposed, non-exposed, and that gives you your answer. ठीक है? All right, moving to the next one. All are advantages of cohort study except. मेरे को वो फोन दे दो, उसको साइलेंट करके दे दो. All are advantages of cohort study except. So now cohort study के advantages की बात हो रही है except, okay? No recall bias is definitely an advantage. Recall bias is seen in which study design, guys? Case control. ठीक है? Relative risk definitely we can study. Incidence definitely we can calculate. Hawthorne bias क्या होता है? It is not an advantage. It is a disadvantage. Very good. What is Hawthorne bias? Subjects modify their behavior on being observed. Like smokers quit smoking in between. So that is a disadvantage. Now please remember, in cohort you have to remember about Hawthorne bias, and what is the other bias you have to remember in cohort? You have to remember about attrition bias. ठीक है? When you talk about case control study design, guys, case control में कौन कौन सा bias होता है? Recall bias, you also have selection bias, and you also have which bias, guys? Interviewer bias. These are all the different types of biases that you have in case control study design. Also, please remember there is one bias known as Bergsonian bias जो exam में आ सकता है. This is hospital admission bias which occurs due to different hospital admission rates. Okay, this is a type of selection bias. Okay, so remember these three things, and bias is eliminated by blinding. The best form of blinding is triple blinding, but the most common form of blinding is double blinding. ठीक है? One more question from Epid, guys, where you have to arrange the steps in a sequential manner. Nowadays, they ask a lot of questions on arranging the steps in a sequential manner. So, who's going to give me the answer to this? This was actually a NEET PG PYQ, guys. It has also come in INI CT exam. So, of course, case control or cohort FMGE exam में आता है. They can also ask you over here. So, can you tell me the answer to this one? Randomization, manipulation, statistical assessment, follow-up. So, what is the first thing that you're going to do? Are you going to do a follow-up the first thing? No. सबसे पहले, what are you going to do over here? The first thing that you're going to do, yes, let's see your answers first. Good. The first thing that you're going to do, everyone, have a look over here. You draw a protocol, okay? You select the population. Then you do randomization. Randomization also assures blinding. Then you do manipulation or intervention, follow-up and assessment of outcome. So if you look over here, the first thing जो आप कर रहे हो, randomization, alright? Then what are you going to do? Then you're going to do a manipulation. Then you're going to do what? Then first thing you're not going to manipulate. सबसे पहले manipulation ही होता है, ठीक है? Randomization हो गया, manipulation हो गया, follow up करोगे, and then you're going to do a statistical assessment. So what is your correct answer over here? Your correct answer is 1, 2, 4 and 3. Okay, remember these steps. Or randomization is only going to assure blinding. So kabhi kabhi exam mein na, after randomization they might show blinding, so that also could be in your exams. Also follow the steps of a cohort study, guys. For the steps of a cohort study, what is the buzzword? Follow up. For the steps of a case control study में तुम्हारा buzzword क्या है? Matching. कभी भी आपको, like whenever you see the word matching, it indicates which type of study design, everyone? Case control. Matching eliminates only the known confounders. Clear? Don't mess up with the steps, guys. Okay, so we have done how to identify study designs. We have also done the steps. Now look at the question that came in NEET PG. Can anyone answer this? A new community-based health initiative is designed to reduce neonatal sepsis. In a community, 20 PHCs follow standard care and 20 are designed to implement this initiative. What study design does this represent? This is a NEET PG PYQ. Can you give me the answer to this, guys? I think, think. No. Socho. Try to come up with the answer. What is happening? Community-based initiative. So what is happening over here, guys? We are definitely doing an intervention. पक्का से intervention हो रहा है, okay? But it's not being done in an individual. It's being done as a community, all right? So what is happening? Instead of taking one person, we've taken 20 PHCs that will follow standard care. So this is like they are getting the placebo, just an example, and 20 are designated to implement the initiative. So 20 are getting the new initiative. So whenever you have any intervention, guys, ये कौन सी study design हो जाती है? This is a RCT. But why am I writing a cluster? Because I'm not looking at an individual per se. I have taken a collection of 20 PHCs. Did you understand? It was only because, you know, kabhi same board sets the paper. So the question from NEET PG could come in your exam and from FMG could get copied in NEET PG. So we have to look at the PYQs, latest PYQs of both the exam, everybody. Alright, so here what is the answer? It is a cluster randomized trial. Bhulna nahi. What is quasi-experimental? Anyone can tell me quasi-experimental? This is natural experiments in which what is happening? Experimental design hai but no randomization. It is experimental but no randomization. No randomization means no picking of chits, no table of random numbers. Okay, so what are we taking? Natural phenomena जैसे disasters हो गया, to migration studies हो गया. Okay, we don't ask people to migrate. John Snow's experiment was an example of quasi-experimental study. We don't ask people to migrate to some place, but we took advantage of that situation as a researcher. Maybe exam में आ जाए, maybe exam में नहीं आए. Did you understand? Everybody quasi-experimental. It is experimental but without randomization. Clear? So that was your EPID. But one more thing before I go to the next question, I wanted to discuss a couple of buzzwords over here, guys. Can you tell me what is the study design you're going to select in case of rare diseases? As quick as possible in the comment section. Rare diseases के लिए आप कौन सा study design लेना चाहोगे? Rare diseases के लिए आप कौन सी study design लेना चाहोगे? मैं option नहीं दे रही हूँ. What is it? Good, everyone. Case control. Very good, guys. What about rare exposure, guys? Rare exposure. Rare exposure जैसे कि occupational exposure. So which is that you're going to take over here? Cohort. Matching is the buzzword. Case control. Follow up is the buzzword. Cohort study. If you interview diseased, non-diseased, case control. If you look at past records and divide people into exposed, non-exposed, retrospective, cohort. Okay? Now, if you have any other doubt, just note it and I will take it up at the end of this session. So now we're going to move to another topic. Tell me what is DALY quickly. Which of the following statements best describes DALY? It measures years lost to disability alone, measures years lost to death alone, measures years lost to disability and death, measures number of years added to life due to a medical intervention. क्या है? Very good. It measures years lost to disability and death. YLL plus YLD. Number of years lost to premature death and number of years lived with disability. Please remember, this is the best measure of disease burden. ठीक है? Best measure of disease burden. Any student in the class who can tell me what is option D? Any student in the class who can tell me what is option D? Suppose तुम्हारे options थे Daly, Quali, Hale, Sullivan's Index. What is option D? Can you tell in the comment section? Is it Daly? Is it Hale? Is it Sullivan's Index? Is it Quali? क्या है? Very good. So happy to know this. Quali. What is it? Quali. Quali क्या होता है? Number of years that get added to your life due to a medical intervention. Okay, so now what I've done, guys, to make your work a little easier, if you go to the next slide in the PDF, you will find a little bit of information about Daly and Quali. So you can quickly give a read through it. Hale क्या होता है? The buzzword for Hale is going to be full health. So this is also a PYQ. You should read these slides in the PDF. They are equally important. And what is Sullivan's Index? Anyone in the class? What is Sullivan's Index? I'm not discussing in too much detail, but life expectancy minus duration of disability. Life expectancy minus duration of disability is Sullivan's Index. So go through the PDF for Daly, Quali, Hale as well as Sullivan's Index. Another slide in the PDF is again important. Here I have list down for you a couple of health indicators. ठीक है, ये PDF में भी slide, this is like a go to exam slide. What are the different morbidity indicators? You should know the name: incidence, prevalence, notification rate, duration of hospital stay, spells of sickness, sickness absenteeism. What are the different healthcare delivery indicators? Doctor population ratio, population bed ratio. What are healthcare utilization ratio? What are health policy indicators ratio? This is a PYQ. Now I'm going to ask you, what has India said? It is going to spend what percent of GDP? 2.5% of GDP by 2025. ठीक है? And WHO क्या बोलता है? For any country to be developed, 5% of GDP should be spent on health. 5% of GDP should be spent on health. ठीक है? So this is your revision slide. For event type disability indicator also I have written, and person type also. Whatever is given in the PDF, you will not miss any point before you go to your exam. That is my humble request to each one of you. ठीक है? Moving ahead, Ayushman Arogya Mandir. Patao, provide which of the following facility? Why have I given you this? This is a latest NEET PG PYQ. I am covering all the latest NEET PG PSM PYQs also, so that you don't miss out. Ayushman Arogya Mandir. Provide which of the following facility? Very good. It is option D. बट कभी आपको पता है आयुष्मान आरोग्य मंदिर क्या होता है? सो आयुष्मान आरोग्य मंदिर इज दैट वी हैव अपग्रेडेड अंडर द आयुष्मान भारत स्कीम. सो लेट मी स्ट्रेट अवे टेक यू टू द लोगो. दिस कुड कम इन योर एग्जाम, गाइज. दिस वाज द लोगो ऑफ हेल्थ एंड वेलनेस सेंटर्स. ओके, सो अंडर आयुष्मान भारत वी अपग्रेडेड सब सेंटर्स टू HWC, and now what do we call them as? Ayushman Arogya Mandir. They provide a wide range of services which you should go through. All the reproductive, maternal, neonatal, child health, adolescent health plus nutrition services, non-communicable diseases का भी सर्विसेज प्रोवाइड होता है. पैलिएटिव रिहैबिलिटेटिव केयर, ओरल आई ENT केयर, मेंटल हेल्थ केयर इज ऑल्सो बीइंग प्रोवाइडेड नाउ राइट फ्रॉम द लेवल ऑफ सब सेंटर्स, गाइज. इमरजेंसी ट्रॉमा, फर्स्ट लेवल केयर, फ्री एसेंशियल ड्रग्स, डायग्नोस्टिक सर्विसेज. यू मस्ट नो दिस. अदर देन दिस, आई होप यू रिमेंबर, दिस इज आयुष्मान भारत का लोगो, PMJ स्कीम, वेरी वेरी इंपॉर्टेंट फॉर योर अपकमिंग एग्जाम्स. दिस इज अ वे टू अचीव व्हाट? यूनिवर्सल हेल्थ कवरेज इन इंडिया, नॉट प्राइमरी हेल्थ केयर, यूनिवर्सल हेल्थ केयर. And how many Ayushman Arogya Mandir we are trying to create, guys? 1,50,000. And PMJ means we are providing health insurance coverage of how much? 5 lakh per family per year to poor and vulnerable families for secondary and tertiary level treatments. Number of age of family members, and number of family members is no restriction. I hope you remember. Number of family members, no restriction. Number of family members, no restriction. ये सब भूलना छोड़ना नहीं है एग्जाम के लिए. ओके, सो दीज आर इक्वली इंपॉर्टेंट थिंग्स. सो वी हैव कवर्ड 3 logos also along with Ayushman Bharat. Next, let's see. This is again a latest NEET PG PYQ, last one which came, and it can very well get repeated for our FMG exams. Tell me the answer. We have to, I hope my speed is okay. I'm not going too fast or too slow. It's fine for everybody. Whatever you can't get, please note it down. Ask me towards the end, because remember, we need to cover whatever possible we can in these couple of hours. Okay? Time period between the receipt of infectious agent into the host body and period maximum infectivity. Maximum infectivity is generation time. Incubation period, median incubation क्या होता है? Entry of organism to 50% cases. Median means 50%. To 50% cases to occur. Alright, that is median. What is serial interval? Interval between primary and secondary case. I am sure you all know incubation period, so I am not going to talk about that. हाँ, latent period याद रखेंगे सब. Latent period is nothing but incubation period for kind of NCDs. It's a term which is used for NCDs. ठीक है? चलो. Let's go to the next one. What is the dosage of vitamin A given for a 2-year-old baby with keratomalacia? Now, am I talking about the preventive dose or treatment dose? You all know vitamin A is the Bible of PSM. You will expect a question on this. So, I've given you a question. What is the dose of vitamin A for a 2-year-old baby with keratomalacia? So, anybody who's coming up with an answer, why don't I see your answer? वेरी गुड. सबसे पहले याद रखना ये ट्रीटमेंट डोजेस है. सो व्हेन आई टॉक अबाउट ट्रीटमेंट डोजेस गाइज, इट इज सेकेंडरी लेवल प्रिवेंशन, इट इज नॉट प्राइमरी लेवल. एंड आई होप यू नो दैट वी हैव टू डिवाइड आवर चिल्ड्रन इनटू 6 months, okay, then 1 year, and we have to divide it into more than 1 year. All right, day 1, day 2, day 14. You can also say it as day 0, day 1. That's okay. You can also say it as day 0. You can also say it as day 1. Chalega. That doesn't really make that much of a difference. But if you talk about, let me write this again. Okay, suppose I say day 0, day 1. Also, I can say day 14. I can say 1 to 14 also, whatever. Okay. Now over here 6 months is up to 50,000 international unit. 50,000 हो गया, 50,000 हो गया. 1 year में कितना है guys? 1 lakh, 1 lakh, 1 lakh international unit. And over here what is it? 2 lakh, 2 lakh, 2 lakh. Now here the baby was 2-year-old. So what we have to do? 2 lakh international unit immediately followed by same dose 24 hours later and after 2 weeks. Clear? So that is your answer. But over here what was the catch? अगर बच्चे का weight, if the baby's weight is less than 8 kg, then how much is the dose? The dose will always be 1 lakh international unit for a SAM baby. Okay, remember this catchy highlighting point. ठीक है? Don't forget it. It can come in your exam. Alright, moving to the next question. Can anyone tell me this one? A 60-year-old man residing in a village in Andhra Pradesh presents to the health facility with genu valgum and requires a stick for walking. He also mentions that many other elderly individuals in his village have similar complaints. What should be the most appropriate next step in the investigation? क्या करना है इसमें? Andhra Pradesh buzzword, genu valgum buzzword, other elderly. So will you measure serum calcium level, do parathyroid hormone, vitamin D? No. What is we are going to do? Fluoride. Now a person in Andhra Pradesh presenting with genu valgum requiring a stick for walking. Please don't go and mark it as neurolethyrism over here, okay, because we're not talking about that. It has not mentioned about any staple diet or something. Okay, so here what we are going to stick to, this is actually a case of skeletal fluorosis, guys. This is actually a case of skeletal fluorosis. Okay? In the exam, you could get this image. Can you see everyone? This is a characteristic image which could turn up in your exam. This is genu valgum, Knock-Knee syndrome. Okay, so here you can get this image. And what else? Please remember, fluorine के बारे में अगर हम लोग बात करें, what are the things that you need to remember? Double-edged sword. Let me quickly revise fluorine with you. Double-edged sword है, ठीक है? fluorine is double-edged sword. That means normal fluoride level is 0.5 to 0.8 milligram per liter. This is the normal fluoride. Less is also a problem. If it is below 0.5, then it will lead to what, everybody? Dental caries. Dental caries is the most common school health reported infection. Okay? But if it is more than 1.5, what is it leading to, guys? Dental fluorosis. As you can see over here, what is happening? Mottling of the upper incisors of the tooth. Okay, the corrosive enamel pura corrode ho jata hai. First 7 years of life, if a baby is consuming, child is consuming more of fluorine and water, this can happen. Then you have skeletal fluorosis. What is skeletal fluorosis? Fluorine is how much? 3 to 6 milligram. And then this one that you see, you have what? Crippling fluorosis. And when you talk about crippling, it is 10 milligram per liter. This has come many times, guys. Crippling fluorosis value. And how do you remove the excess of fluorine from water? Anybody in the class? How to remove excess of fluorine from water, guys? What is the name of the technique? I hope you remember the name of the technique is Nalgonda technique, which is meant to remove excess of fluorine from water. और इसमें पानी में 3 चीजें ऐड करेंगे. The mnemonic is lab. Please remember lime, alum, and what is it that else we are going to add, everybody? Bleaching powder. Last time NEET PG has asked this Nalgonda technique. We discussed this many times. Developed by, not going into too much detail for that, Neeri Institute, Nagpur. ठीक है? Neeri Institute ने chlorine tablets भी बनाया. Okay? Chalo, going to the next question. So done, fluorine revision, mostly expected. Alright, let's go to school health. Give me the answer as quick as possible over here. All of the following are minimum standards for sanitation of school and its environment in India except. So what is the topic that I want to revise over here? I want to revise over here school health examination. Okay, I want to revise school health examination or school health checkup. School health basically. Desk minus type. Yes. Combined doors plus windows, minimum 25%. Yes. Maximum 40 students. Yes. One urinal is for 60 students and one latrine is for 100 students. Light किधर से आती है, guys? Light has to come from the left side. Okay. Then floor space. Every student is going to occupy floor space of at least 10 square feet. Okay. This has also come in the exam. Then another thing, school health is the responsibility of, please remember, not sub-center, it is the responsibility of PHC. और यहाँ पे जो medical officer होता है, he has to conduct a school health checkup. How many times? Has to conduct a school health checkup, everybody. कितनी बार करेगा? Twice per year, okay, biannually, twice per year. Does the medical officer have to be posted in the school premises? No, not in school premises. You don't want him to be there in the school premises, okay. Visual acuity भी exam में आया हुआ है. If the cutoff is 6/9, visual acuity का screening teachers भी कर सकती हैं. If it is less than 6/9, they will be referred to a PHC where you will have a paramedical ophthalmic assistant. School health promotion is also being done under, please remember, Ayushman Bharat. It is promoting school health, जिसमें basically deworming का बात की जाती है. Clear? Got it? Most common infection, dental caries. So couple of things that we had to revise. Alright, going to another important topic. Anemia Mukh Bharat, batao answer. As per the weekly iron and folic acid supplementation program, what dose of IFA tablets is provided to children in the 10 to 19 year age group? Now here there is a slight confusion. That is why I've come up with this question. Again, this is a NEET PG PYQ only, guys. यहाँ पे please don't mark 100. Please don't mark 100. When I use this term WIFS, no, it is, we are referring to AMB only. Anemia Mukh Bharat, particularly for the adolescents. What is the dose now? 60 milligram elemental iron and 500 microgram folic acid weekly. And सारे बच्चे comment में लिखो, every student in the comment, what is the color of the iron tablets over here? What is the color of the iron tablets that we are giving to adolescents, everybody? What is, this is adolescent, boy girl दोनों को मिल रहा है, okay? So what is the color? Iron की नीली गोली, नीली गोली बोलते हैं. It is actually blue tabs, okay? So let's quickly, in a span of 1 minute, revise in and out of Anemia Mukh Bharat. So lesson number 1, this is the logo of Anemia Mukh Bharat. Okay, now in this we have to provide prophylactic iron folic acid tablet. Aana hi aana hai, no escape. Prophylactic iron and folic acid tablets. Okay, so how much do we have to give? So here you have iron, here you have folic acid, here you have the schedule. So I want your help, guys. 6 to 59 months. First 6 months absolute nothing because mother के milk में iron होता है and bioavailability of iron is very good. So here after 6 months 20 milligram elemental iron, 100 microgram folic acid has to be given bi-weekly in the form of a syrup. When I talk about 5 to 9 years, everybody 4 and 4, 45 milligram 400 microgram folic acid has to be given weekly. पिंक कलर की गोली है, पिंक टैब्स. 10 to 19 year old already done. So we've discussed 10 to 19 year blue tabs है, 60 milligram elemental iron, 500 microgram folic acid. This again has to be given weekly, blue tabs. Okay, reproductive age males and reproductive age female, sorry, 60 or 500. ठीक है, this has to again be given weekly and this is red tabs. प्रेग्नेंट क्वेश्चन आ चुका है, 6500 डेली डेली डेली. ओके, रेड. एंड व्हेन डू वी स्टार्ट गिविंग दिस? दिस इज अ PYQ. व्हाट आई एम गोइंग टू राइट ओवर हियर राइट नाउ, इट इज गिवन फॉर प्रेग्नेंट एंड लैक्टेटिंग women, given from when, guys? Given from second trimester up to 6 months post lactation, up to 6 months post delivery, up to 6 months post delivery. ठीक है, ये भी PYQ रह चुका है. And tell me something, what is the purpose of giving iron? So the purpose of giving iron is to prevent iron deficiency, anemia. And what is the purpose of giving folic acid? कभी मत बोलना neural tube defect. No, the purpose, it's anemia mukt Bharat. So what is the purpose of giving folic acid, everybody? To prevent, who's going to tell me? And I'm also writing that, to prevent megaloblastic anemia. होता है ना, whenever we talk about folic acid, NTD comes to our mind, but here it is not NTD. What is it? Megaloblastic anemia. Another very important cause of megaloblastic anemia, guys, if you remember, is alcohol. ठीक है, so you should remember these things. मतलब देखो अब इंसान का दिमाग, like think, I am saying don't write, don't ever say NTD. And what was happening? I wrote NT. Because it happens, but you cannot afford to do that. Okay, you have to be very vigilant in the exam, guys. And these are the interventions. Please go through these interventions also. I hope you remember 6 into 6 into 6 strategy hai for anemia mukt Bharat. What is this 6, everybody? 6 is beneficiaries. All right, 6 is beneficiaries, 6 is interventions. And who's going to tell me the other 6? Who's going to tell me the other 6? Is it coordination ministries? No, not at all. It is institutional mechanisms. It is institutional mechanisms. ठीक है, so revision done. आयरन फॉलिक एसिड खिलाएंगे, डीवर्मिंग करेंगे. प्रेग्नेंट फीमेल्स की भी डीवर्मिंग होती है. इट्स बीइंग डन इन द सेकेंड ट्राइमेस्टर बेसिकली. 2 deworming days are 10th of Feb and 10th of August. These are your deworming days, guys. Then we will also do behavioral change, communication, health education basically. Delayed cord clamping है, not early cord clamping. Test anemia using digital methods. ठीक है, mandatory provision of iron folic acid rich food and addressing non-nutritional causes of anemia. ठीक है, another thing बिल्कुल, ये मैंने एडिशनल दे दिया है गाइस, अनीमिया मुक्त भारत का मैनेजमेंट. इसको देख के जाना. व्हाई हैव आई गिवन यू दिस? दिस इज अ INICT PYQ. सो बिकॉज दे आर सो फॉन्ड ऑफ अनीमिया मुक्त भारत, दे कैन कम अप एनी टाइम विथ मैनेजमेंट. सो प्लीज रिमेंबर, इफ इट्स माइल्ड टू मॉडरेट अनीमिया like below 9, okay, something. So if it is gestational age below 34 weeks, you should give 2 tabs of iophen, not 1 tab. But if it is age more than 34 weeks, then you will have to give IV iron sucrose. But less than 34 weeks, not tolerant, you will give what? IV iron sucrose. कभी भी IM मत देना. But if it is a case of severe anemia, everybody, in that case, whether it is first or second trimester, no oral tablets, only injectables have to be given, and in very severe conditions, we have to hospitalize. Now I want a thumbs up. In and out of anemia mukt Bharat has been covered. कोई भी question आ जाए, you should know. AMB is which which level of prevention everybody? Primary level. It is prophylactic measure. Okay, give me a thumbs up. I'm going to the next question now. All right, let's see this pneumonia management, guys. Let's see what you do for this one. A 5-month-old child reported to sub-center with complaints of fever and breathlessness. Great, thank you so much. Let's move ahead. A 5-month-old child reported to sub-center with complaints of fever and breathlessness. On examination, respiratory rate 55 per minute hai and presence of chest indrawing hai. What is the ideal management in this case? So pneumonia, I will revise with you. I will revise pneumonia, I will revise tetanus, I will revise rabies, I will revise HIV, TB, vector-borne. बस आपको सुनते रहना है, ठीक है? And be interactive, okay? Let's do this one. So what is the answer over here? Now I will take you straight away to the explanation, ठीक है? So please remember, we classify pneumonia on the basis of IMNCI. IMNCI covers 0 to 5-year-old. IMNCI में we manage 5 diseases. We can manage pneumonia, we can manage diarrhea, we manage measles, malaria, malnutrition. 5 diseases. अब यहाँ पे देखो, first you have to look less than 2 months, you have to see 2 months to 5 years. So if there is no chest indrawing and or fast breathing and no fast breathing और मत करो and no fast breathing, दोनों में no problem, no pneumonia, no pneumonia. So in this case, what is the color that we are going to put these babies into? We are going to put them in green zone. Green zone means home management. You definitely don't have to worry. Symptomatic care कर लो. But if you look at this one, if you go to the next one, everybody, chest indrawing है या fast breathing है or both are present up to 2 months. Remember, less than 2 months is a danger sign. So we have severe pneumonia. In severe pneumonia, we put it in pink category. Pink category मतलब give first dose antibiotic, give first dose syrup amox, give first dose of syrup amox everybody, and then कहाँ refer करोगे? Refer to where? CHC, okay, because there is a pediatrician. But over here, pneumonia, that is okay. For 2 months to 5 years, you don't have to worry. So this baby will fall in which zone? Yellow zone, okay. This baby is going to fall in yellow zone. So if you have yellow zone, it is nothing but OPD treatment. OPD treatment, give syrup amox, send back home, follow up karao. Follow up in 2 days, okay. Follow up in 2 days. But if the baby has any of these danger signs, stridor in a calm child, lethargy, cyanosed, very high breathing, all right, not breastfeeding, all these things, very severe, severe. दोनों को किस में डालोगे? Pink में डालोगे, and you are going to refer them to where everybody? To a CHC, where you have a pediatrician. Please pay very good attention to this slide. One more thing, guys, what is fast breathing? Can anyone in the class tell me what is fast breathing? Who remembers? So ये है fast breathing का भी PDF मिल जाएगा तुमको slide में. You will get the fast breathing, this thing. Rule of 60, rule of 50, rule of 40. So up to 2 months, if the respiratory rate is more than 60 per minute, guys, it is fast breathing. 2 to 12 months, guys, respiratory rate of how much? More than 50 per minute, okay. And what is this? 1 to 5 years, respiratory rate is more than 40 per minute. No messing up with these things. These have to be in your tips. Even if I wake you up at night at 2 o'clock and ask you, give me the rule of fast breathing, it has to be on your tips, guys. Now come to the question. Let's see the question. So the baby has come with 5-month-old. That means the baby falls in this classification. Respiratory rate, fast breathing, कब बोलेंगे उसको? More than 50. So over here, definitely the baby over here has fast breathing and chest indrawing. So what is it the baby is falling into, guys? Pneumonia, not severe. No danger signs as such. Weight का कुछ mention नहीं किया है. Nothing else is mentioned. So what will we do? We will put the baby in yellow zone as per IMNCI, give him antibiotic and ask for return to follow-up. ठीक है? Please do revise pneumonia management before you go to your exam. I'm sure you will also revise it in pediatrics. ठीक है? अब आ जाओ rabies. Dog bite. So let's talk about dog bite management. I'm sure, sorry, एक option has got hidden. So another option D is 1, 2, 3, 6. Now what I'm going to do is, I'm going to read out all the options and you're going to tell me for each of this statement, is it true or false? A child was bit by a street dog. Your buzzword over here is bit. On examination, aversion of 1.8 centimeter, slight oozing. Tell me, identify the correct statement. Again, I'm not interested in the answer, guys. मेरे को हर एक statement पढ़ के बताओ. Is it a category 3 wound? True or false? Is it a category 3? I want the answer in terms of true and false. Is it a category 3 wound? Of course, the person has been bit with slight oozing. That means blood hai. So this is a category 3 wound. Okay. Wash the wound with normal tap water for 15-20 minutes. Always. Yes. Clean the wound with spirit. You can use spirit. You can use some amount of iodine. You can use it. Absolutely no problem. Loose suturing. कभी suture नहीं करना है. If you suture the wound, if it is virus, the virus may get trapped. Okay. Equine immunoglobulin is given at a dose, but twice, no. First of all, what is the immunoglobulin that we prefer, everybody? Human immunoglobulin. And how much? 20 international unit per kg body weight. Most of the immunoglobulin is given where? Around wound site. Okay, most of the immunoglobulin is given around the wound site. Okay, immunoglobulin can be given up to 7 days from day 0. Up to 7 days from day 0. Day 0 is the first day of vaccine, not dog bite. Okay, and if we don't have human, we will go for equine. Okay, then intradermal regimen is this one. Absolutely correct. Intradermal is updated. Thigh Red Cross. Thigh has 4 letters. So how many visits we are going to make to the doctor? 4 visits. Day 0, 3, 7, 28. So what is the correct answer over here? 1, 2, 3 and 6. Okay, 1, 2, 3 and 6. Now let me revise with you a couple of things. Please look at these categories. You will not mess up this category. Category 1 to theek hai, touching or feeding animals, licks on intact skin, that's okay. Category 2 is minor scratch without bleeding, no bleeding at all. So treat the wound, anti-rabies vaccine. Okay, but category 3 guys, multiple single bite, contact with bats, licks on broken skin, bleeding present, we will also add immunoglobulin. But one catch, for HIV positive, immunoglobulin added in category 2 also. Immunoglobulin added in category 2 also. Okay, for HIV positive, that's an exception. Okay, one more question guys. Rabies vaccine is a live or a killed vaccine? Who's going to tell me? Rabies vaccine live vaccine है या killed vaccine है? Pregnant female को लगाओगे या नहीं? Rabies vaccine हमेशा, always we have to give number 1. The best thing, it is a killed vaccine. Okay, and we know rabies has a 100% case fatality rate. So you will definitely give it. Then I have given you wound management details also. Sometimes they ask, why should you wash the wound with running water? It removes the virus then and there. Chemical treatment, देखो, apply disinfectant, inactivates the virus. Biological immunoglobulin neutralizes the virus. This could be an expected MCQ in the FMGE exam. Okay, and the regimens, you will go through it guys from the slide over here. Post exposure, this is updated thigh. This is updated thigh Red Cross regimen. 03728 222 2 sites simultaneously. Intramuscular SN है. SN में there are 5 letters. So how many visits we are making? 5 visits, but it is given at one site. Okay, and here I have written the site also, so you can read that. Pre-exposure prophylaxis, suppose veterinarians or forest officers. So pre has 3 letters, so we will give them on. Okay, we are not actually in a rush. Day 0, 7, 21 या 28 days, whichever is important. Pregnant female को rabies vaccine लगता है, please don't mess it up. ठीक है, लगता है. Re-exposure is important. Re has how many letters, everybody? 2 letters. So how many visits we are going to make? 2 visits. But the thing is day 0 and 3. But when will you give it? Please remember, if re-exposure is within 3 months, okay, re-exposure is within 3 months. अगर within 3 months हो रहा है, just wash the wound. But if it is beyond 3 months, then re has 2 letters, so 2 visits, day 0, day 3, IDIM, you can give any regimen. Will you remember this 3-month wala thing, everybody? Will you remember the 3-month? It's lifelong. Immunoglobulin also giving once is lifelong. Okay, rabies free zones in India. Andaman, Nicobar, Lakshadweep, okay, rabies free. This was asked in your exams before. Andaman, Nicobar, and Lakshadweep, okay, all of these are rabies free. Also, one more thing, to control dog rabies, okay, to control dog rabies, what has to be done? We have to vaccinate the dogs. क्यों? क्योंकि 80% dog population accessible है in an area. This was asked in NEET, okay, this was asked in NEET PG. So you should remember this, how to control dog rabies. Done. Pneumonia management, rabies management कर लोगे ना सारे, I mean dog bite management. Oh, one more thing, any form of prophylaxis, whether it is post exposure, whether it is pre exposure, ये सारे prophylaxis है. So which level of prevention are these? Primary level. I told you also, vaccine administration is always and always primary level of prevention. Mess up नहीं करना है. अभी rabies हुआ नहीं है, we are not yet having rabies, but we are at risk of rabies. ठीक है? कोई भी word, when you see, no guys, when you see these words prophylaxis, it means primary. Great. Let's go to some NCDs, common questions for our FMG exams. Which of the following indicators of obesity is obtained by dividing weight in kg by square of height in meters? क्या है answer? So what is the answer over here? What is it? Quetelet index. Very good. BMI. Who is going to tell me from this option only? अगर question आता height independent obesity indicator, what is your answer? Height independent obesity indicator. Height independent obesity indicator. Answer बताओ. Height independent from these ABCD. What is your answer? Height independent obesity indicator क्या है everybody? Corpulence index. Height independent obesity indicator is corpulence index. Good, you remember. So I have again in the PDF given you all the obesity indicators. You can definitely revise it. BMI is the same as Quetelet index. Okay, weight in kg, height in meter square. पॉन्डरल इंडेक्स होता है, जस्ट इसको उल्टा कर दो, ठीक है, हाइट इन सेंटीमीटर अपॉन cube root of body weight. Okay, they'll not ask you this, but they ask you this. Actual weight upon desirable weight, cutoff is 1.2, Broca's index and Lorentz formula. So you should know obesity indicators. And these are some other indicators to assess obesity. You should know the values. कभी मत सोचना ये basic values will not be asked in the exam. They are basic things. कभी भी question में it can come. You measure using Herpendon's caliper. What are the 4 sites that we take? Triceps, biceps, subscapular, suprailiac. You should know the values in boys as well as in girls, less than 40 and less than 15 girls. Waist circumference, I only want you to remember the global one, ठीक है? And waist hip ratio, more than 1 in men, more than 0.85 in women, ठीक है? Is it clear? And classification of BMI chart also I have given to you. Please look at this. Global population according to WHO, obesity is more than equal to 30 and Asian Indian it is more than equal to 25. If nothing is mentioned, you will go according to WHO. ठीक है, मजा आ रहा है? Everybody enjoying the session? I hope you are, है ना? Alright, remember it's a revision session, guys. We have to be a little fast also. We don't have too much time with us, but I hope I can give you all the PYTs. मेरा purpose है PYTs, NEET, PG and FMG. दोनों cover करना. Okay, for all of you in this session. Okay, let's do a numerical. Take your time. Imagine you're in the exam hall, Okay, the numerical pops up. You are supposed to focus on the screen, guys. You can't look this side, look that side, है ना? You have to focus. Never panic. Try to see ma'am ने क्या पूछा, examiner ने क्या पूछा है. What are the values given to me? Don't mug up. This is a PYQ, okay? This is a PYQ which came in NEET, FMG both. So we are trying to revise that, okay? So I don't want you to mug up the answers. I want to focus on the approach. Number one, can anyone tell me, here it is given live births. So am I referring to rate or am I referring to ratio, guys? So if I have live births, that means numerator is not a part of denominator. So I am definitely referring to ratio. Okay, now what is maternal mortality ratio? Now I have told you in the entire PSM, everybody, in the entire PSM, there is one and one formula only, जहाँ पे multiplier क्या होता है? 1 lakh होता है. ठीक है, that's the only formula. Now over here, what is the numerator? Total number of maternal deaths, ठीक है, in a year in a community, okay, during a specified time period, in a specified time period, that's okay, that is understood in a community, out of the total live births, ठीक है. Now see what are the things given to you. So you have been given this live births. So you have the denominator, agreed. But look over here. What is maternal death? It is the death during antenatal period. It is the death during delivery and also up to how many weeks post delivery? 6 weeks post delivery. Also 6 weeks post delivery. Not 6 months, 6 weeks post delivery. But what am I to exclude? I have to exclude the accidental / incidental causes. ठीक है, accidental / incidental causes आपने हटानी है. So now over here, see, peripartum infection can be happening due to pregnancy. We will count this. Electric shock, no. Electric shock, accidental, incidental, road traffic accident हो गया, slips in washroom, slips from series of stairs, electric shock, you won't count it. 2 due to obstructed labor, you will count it. 3 due to PPH, you will count it. So what is the total? 5, 6, 7, 8, 9, 10 per 1 lakh. Okay. So this comes out to be how much? This comes out to be 400 per 1 lakh live birth. But can you see, are we given that answer? Do we have 400 per 1 lakh live birth? No. If agar ye answer mein hota, well and good. But over here, this has to be cut. So what is the answer over here? 4 per 1000 live births, everybody. What is the answer? 4 per 1000 live births. Don't get confused. You should always read the question, see what has been given to you, what you have to include, what you don't have to include. Thumbs up, thumbs up. अब ये मत सोचना that ma'am had told us that it will always be 1 lakh. But यहाँ तो it is 1000. That's okay. That's okay. Completely okay. You have to just cut the zeros and that's how you will get the answer. But never forget to remove the accidental and incidental causes. Okay. Moving ahead to some of the programs, guys. Let's see. A patient on heart presents with complaints of fever and expectorant cough for 2 weeks. What is the first investigation of choice? Heart क्या होता है? Heart is, this is not HEART, okay? This is highly active antiretroviral therapy. So basically, I am saying a person living with HIV. Most common opportunistic infection in India क्या है? Most common opportunistic infection, everybody, in India is TB, and it is also the most common cause of death among people living with HIV. So what is the investigation of choice, everybody? CB NAT. Okay, don't say sputum. Sputum karna hai. Remember, sputum microscopy gives us the fastest result. Okay, you just have to stay in the slide and look at it. CB NAT का result 2 hours में आ जाता है. TrueNAT gives it in 1 hour. ठीक है, CBNAT only detects rifampicin resistant under the program I'm talking about. Okay, under the program, only rifampicin. Line probe assay detects rifampicin plus isoniazid also. And इसका result आ जाता है within 72 hours. So that's a good thing. ठीक है? So now, suppose person living with HIV, you did a CBNAT. Now next question. Read this one. n number of times. This has now become a 5-star question. अभी भी आया, पहले भी आया, चलो बोलो. A person in HIV positive, most common opportunistic infection in India is TB. Sputum for the patient is positive. In case of HIV TB co-infection, what is the best line of treatment, guys? So now see what is happening. Person is living with HIV. I did a CB NAT. Now when I do a CB NAT, can be TB positive, can be TB negative. अगर TB positive है, it is what? It is HIV TB co-infection. So when it is HIV TB co-infection, what is it? Start ATT first, followed by ART after 2 weeks. Why? To prevent what? To prevent IRIS, immune reconstitution syndrome. Just know the word right now. Immune reconstitution syndrome. But suppose the person, to prevent immune reconstitution syndrome, suppose the person is TB negative. What am I going to do now? I don't want the person to go on to develop TB. We will do TPT, TB preventive therapy. Now I'm going to give you a question on that. So read this one. A 50-year-old man, I'm trying to give you all the possible situations that can come in your exam. Management पे आजकल बहुत questions आता है guys, ठीक है? 50-year-old man with HIV, 50-year-old man with HIV is screened for symptoms of TB. He reports no cough, fever, night sweats or weight loss. What is the next step? So यहाँ पे now what is happening? We are talking about TB preventive therapy. So for TB preventive therapy, very good, very good. Start weekly dose of rifampicin and isoniazid for 3 months. So what I'm going to do is straight away, everybody question देख लिया, ठीक है? ये इसका explanation देख लो. This is straight away from our textbook of Park. Okay, so we are going to read it once. See, what is written over here? Person living with HIV, adults and children more than 2 years, and household contacts. Okay, HHC means household contacts. So you are also getting a question on that. Household contacts. 3 months weekly isoniazid and rifampicin in persons older than 2 years. This could be a catch in your exam. But if they are less than 2 years or infants less than 12 months, we will stick to the older one, 6 months isoniazid, 10 milligram per kg per day. Okay, remember this is a very, very important thing. And anybody who is on INH, what is the vitamin that we also give? We also give pyridoxine. Clear? Okay, so one question, we did 3 questions in a row. Person with HIV, investigation of choice to detect TB, CB NAT. Agar HIV positive, what has to be done? TB positive, what has to be done? HIV TB co-infection. TB negative, what is it? TB preventive therapy. Chale? Okay, going to the next one. Batao. Present strategy of initial screening of cervical cancer at primary healthcare settings. Now, there's a lot of confusion in these questions, so I wanted to clear it out. Now, answer. The present strategy of initial screening of cervical cancer at primary healthcare settings. Good. See, guys. Primary healthcare settings, sub-center PHC, low resource countries, okay, we go and do a VIA. CHC and upwards, we do a pap smear. WHO क्या बोलता है ना? WHO is suggesting that HPV testing should be done at low settings, at low resource countries also, okay, it should be done at lower levels of healthcare also, lower healthcare settings, okay, but अभी क्या हो रहा है ना? WHO. But right now in India, the government has not provided us kits to detect HPV at lower levels of healthcare. So at primary healthcare settings, we are still sticking to VIA. ठीक है? Then HPV co-testing भी एक आया है, cervical cancer screening का co-testing. Anybody can tell me co-testing में what are the 2 tests that we are talking about? Can anyone tell me co-testing, what are the 2 tests? So please remember, it is HPV plus cytology, okay? It is HPV plus cytology. You should know that, okay? But we are not doing this in our centers. In our centers, at sub-centers, PHC, what are we referring to? We are referring to visual inspection of acetic acid only. Because हमें sub-center में doctor तो होता नहीं. We only have a multi-purpose worker female who is being taught VIA. Another question, I want quick answer to this, okay? My question to you is, screening test for breast cancer? Please give your answer in the comment section. Screening test for breast cancer. What is it? Screening test for breast cancer. What is it, everybody? Yeah, after 30 years, it should be done. Screening test for breast cancer. What is your answer? Jaldi likho, guys. What is your answer? Screening test for breast cancer. Very good, very good. Mammography. Agreed, agreed, agreed. Screening test for breast cancer below 40-year women because of dense fibrous tissue. Below 40 years क्या हो गया? USG. But question ये कुछ नहीं आया. Question doesn't come from these two. Question came that screening test for breast cancer at sub-center, at PHC. What is it? What is it? In community healthcare settings, please don't say mammography. It is breast self-examination. That is where you will get caught in the exam. Okay? Most common cancer India and worldwide. सबसे common cancer, most common cancer India worldwide is definitely breast cancer, guys. Okay? Breast cancer. But most common cancer, everybody, rural India. Rural India में सबसे common cancer क्या है? What is the most common cancer in rural India? So if anybody asks you most common cancer in rural India, guys, it is what? It is nothing but cervical cancer. You should not mess up these points. And now I told you, no, Ayushman Arogya Mandir, we are also screening for cancers. This is what is the best example. No confusion as of now. Okay? Let's move to the next one. Okay, now this is something that is expected. NCDs is floating in all the exams. Okay, it's like floating. So what is your answer to this? 50-year-old overweight man wants to know ways he can reduce the risk of developing coronary heart disease. Which of the following dietary modifications would you suggest to this individual? Dietary cholesterol increase to above 150 per 1000 kilocalorie. ये PYQ था अभी NEET PG में. Okay. I will tell you the answer. पहले answer करो. So what I should do is, let me straight away take you. Total fat less than 5% खाएंगे. Total fat नहीं, बिल्कुल नहीं. What is the balanced diet, guys? What is balanced diet? How much of proteins should be there in your diet? You can't make these basic गड़बड़ नहीं करना है. Proteins 10 to 15% diet में होना चाहिए. Fats खाओ ना. Nobody has asked you not to eat. 15 to 30%. Carbs कितना खाओगे? 50 to 70%. But when it comes to saturated fat, guys, it should be less than 10%. Saturated fats जैसे coconut oil, butter, all these should be less than 10%. But total fats you have to eat. What are the good fats, everybody? What are the good fats? The good fats are the PUFA, polyunsaturated fatty acids. In polyunsaturated fatty acid, which is the most essential fatty acid, guys? Which is the most essential fatty acid? So if you talk about this, it is nothing but linoleic. Linoleic का source क्या है? Safflower oil, sunflower oil. ठीक है? Safflower, sunflower, all these are good sources of saturated. Deficiency of fatty acids क्या कराता है? If somebody is deficient, it will lead to what? Phrinoderma. Phrinoderma क्या होता है? Deficiency. Deficiency of fatty acids, a toad-like skin. Okay, all that one has come in your exams. Now, let me straight away take you to this slide. This is very important for your upcoming exams. Look over here. Total fat intake 20 to 30%. You all know coronary artery diseases are the most common these are the most common cause of disability, okay, which is being reported. Saturated fat less than 10%, 7 to 10% खा सकते हैं. Dietary cholesterol, NEET PG PYQ straight away. What is written over here? Dietary cholesterol to below 100 milligram per 1000 kilocalories, okay. Avoid alcohol, salt intake 5 gram or less, increase complex carbohydrate consumption. Clear? And one more thing, what should be the cholesterol HDL ratio? Anybody? Cholesterol HDL ratio, this should be below 3.5. और इसको एक term दिया गया था, guys, which is known as prudent diet. You cannot mess up these things, okay? So that's why I'm trying to make you revise all this. Please don't mess up these things, okay? All right, going to the next one. WHO steps is done for. Okay, WHO steps approach is done for very famous PYQ. बताओ, surveillance of risk factors for NCDs, surveillance of incidence of NCDs, surveillance of evaluation of treatment of NCDs, surveillance of mortality of NCDs. So what is the answer over here? मल्टी ड्रग रेजिस्टेंट आइसोनियाजिड और रिफैम्पिसिन है ना, तो सीबीनेट करो, इट विल टेल यू अबाउट रिफैम्पिसिन, देन वी हैव अ लाइन प्रोब assay also. Okay, good. It is a method for surveillance of risk factors. It has nothing to do with incidence, evaluation, mortality. It has nothing to do with therapeutic management. No, it is to find out about the risk factors. All right. This is the once before we go to the program image. 1 second. This is the steps approach. All right. This is the steps approach. Now, as you can see in the steps approach, पहले step में questionnaire fill करो. So in this we take all the lifestyle, behavioral, psychological factors. We ask all the lifestyle, behavioral, psychological factors. Do you drink? Do you smoke? Do you exercise? All those type of questions. Physical measurement is what? Anthropometry. We are going to take the height, weight, do a blood pressure and all that. Biochemical is lab measurement. So basically we are trying to find out who is at risk of NCDs. Okay? Please remember, look at me, remember, steps approach is not for treatment, not for incidence, not for finding out mortality. It is for risk factors. Clear? This is the logo of the program, guys. This is the new name of the program. What is the new name? National Program for Prevention and Control of NCDs. Earlier it was called Cancer, Diabetes, Cardiovascular Diseases and Stroke. This was the old name, but now we have the new name. Health in your own hands could be asked in your exams as a tagline. What are the newer inclusions? Anybody in the comment section? Newer inclusions क्या क्या हो गया है? कोई बताएगा comment section में? Newer inclusions. Blood group is not a part to assess NCDs, guys. हारिका, बच्चे blood group से कुछ NCD का लेना देना नहीं है. Okay, everybody, no blood group. Please remember, we are not talking about blood group over here. ठीक है. So what are the newer inclusions? COPD, asthma, all right, chronic kidney disease, rheumatic heart disease. Rheumatic heart disease के लिए एक special mission होता था, जय विज्ञान mission. If you know जय विज्ञान mission, all right, then you have what else? Non-alcoholic fatty liver. A very good indication of that is abdominal obesity. Okay, non-alcoholic fatty liver. Then non-ST elevation MI, non-ST elevation MI, and also we have all the Ayush modalities that have become a part, and all these inclusions now we have included them in Arogya Mandir. Clear? Okay, moving to the next question, match the STI color kits. Now if you talk about STI color kits, everybody, अगर आप STI color kits की बात करोगे, so why did I give you the question? Because I wanted to show you a slide. We don't have 7 kits now. We have how many kits? 8 kits. So let's see your answers, guys. L lower abdominal pain, यानी ये कौन सा है? Kit number 6, which is yellow. L से lower. Now first kit is a very dull color, gray color, so it is going for urethral discharge, cervical discharge, gray color. Non-herpetic ulcer, life ठीक है, अभी herpes नहीं हुआ है. So what is it? White. And ladies first, vaginal discharge, vaginitis, green color. So this is it. So this match the following you can do yourself also, but you have to take home this slide. Okay, this slide I have tried to give you all the latest, whatever is the treatment also for the kids as well as the this thing. Okay, now look at this. First kit is gray. Gray is a very dull color. Everything goes with it. So you have 2 syndromes over here. UD, urethral discharge, cervical discharge, and also painful scrotal swelling. Treatment azithromycin. Kit 2 क्या है? Ladies first. Green. Green मतलब now vaginitis. Here vaginitis but referring to cervical discharge. Secnidas, fluconazoles. Kit number 3. Abhi, there is ulcer, but it's not herpes. It could be syphilis and chancroid. And the good thing, penicillin is acting on it. Okay, so the peaceful color is white. Now a little bit of problem, penicillin is not going to act. So we have a little darker color, blue. Okay, here allergy to penicillin. So it's still non-herpetic. You can give BD, blue doxy. Kit 5, danger, danger, danger. Danger is always red. Herpes, acyclovir. Kit 6, now no ulcers, no discharges, pain leke woman आएगी. PID, lower abdominal pain. Again, cephalosporins can be given. Kit 7, bubo, B for B, doxycycline. Kit 8 is the new one, anorectal discharge, जिसमें cefixime and doxy देते हैं. ठीक है? Yeah, if you can refer from the mnemonic. Otherwise, guys, it's very, very easy, ठीक है, to remember the STI kits. Let's go to next question, guys. The next question is, thank you, Prometheus, great score. Okay. A TB patient whose biological specimen is resistant to more than one first-line anti-TB drug other than both HNR is classified under programmatic management of drug-resistant TB as, what is it? ध्यान से देखो. Other than, the person is not resistant to isoniazid and rifampicin. Other than लिखा है, you cannot make this basic mistake. What is this? This is polydrug resistant. Other than, if a person is resistant to HNR, who is he? He is a MDR. What is polydrug? Resistant to two or more than two drugs, okay, more than one first line drug, but not isoniazid and rifampicin. Because if somebody is resistant to isoniazid and rifampicin, they are MDR. Now, what is pre-XDR, guys? Pre-XDR is MDR plus resistant to what? Resistant to any fluoroquinolone. Resistant to any fluoroquinolone. Except which one? Except levo or moxi. Except levo and moxi. Levo and moxifloxacin. And what is your XDR, everybody? So XDR is nothing but pre-XDR plus resistant to what? Resistant to any group A drugs, okay? Resistant to any group A drugs. What are the group A drugs, guys? So when I talk about group A drugs, it could be levo, it could be moxi, it could be bedaquiline, it could be linezolid. It could be linezolid, okay? So don't mess up these things. This is very, very important. It could come in your exams, ठीक है? Okay, what is the current treatment duration for MDR TB? I hope all of you know 6 months hai. BPAL-M regimen from your pharma. You should know the in and out of this BPAL-M regimen. It is expected in your exams. Great, great, great. Monodrug means resistant to any first line drug other than rifampicin, okay, other than rifampicin. Because if anybody is resistant to rifampicin, we can call him as a rifampicin resistant TB, ठीक है? Okay, these are certain logos from TB, guys. ये तो program का logo है. We wanted to eliminate TB by 2025. Eliminate TB by 2025. This is National TB Elimination Program. This you all know. This is NICSHE. This is a web-based portal for notification of TB patients. Notification of TB patients. This has come in the exam many times, everybody. And for leprosy patient, what is the term that we use? Anyone remembers? Nikusht. Nikusht किसके लिए है? So if you talk about Nikusht, this is for leprosy patient. And if you talk about Nishche, Nishche is free UPT kit, okay? Free UPT kit, which is provided by whom? Asha देती है. And this one, guys, is DOTS 99. What is this? TB Mukt Bharat. Please don't say this is the logo of the program. No. TB Mukt Bharat is a newer initiative which was taken up to accelerate elimination of TB by 2025. यहाँ पे हम लोग क्या किए? We came up with the concept of NICSHE Mitra. NICSHE Mitra means we are going to adopt TB patients as our friends. We are offering them compliance and support everybody minimum 6 months to 3 years. ठीक है? And do you all remember NICSHE Poshan Yojana? NICSHE Poshan Yojana में, guys, what was the nutritional incentive, if you remember, for NICSHE Poshan Yojana? For NICSHE Poshan Yojana, nutritional incentive कितना है NICSHE Poshan Yojana में? ₹1000 per month. Earlier it was 500. Now it is ₹1000. Okay, great. Let's move to the other one. Now let's do a couple of questions from HIV. A baby is born to a HIV positive mother. The mother claimed that she is not on ART. What should be the management of the baby? बताओ. Prevention of mother to child transmission of HIV. So what is it? So what are you going to put? The baby is put on, very good, nevirapine and zidovudine for 6 weeks if exclusively on replacement feed. So happy to see all your answers. Very good, guys. So straight away iske explanation pe chale. Everybody, let's straight away go to the explanation. So this is from our program guidelines, everybody. This is what we follow. Prevention of parent to PPTCT, prevention of parent to child transmission of HIV. This contributes 5% of total cases, okay, contributes 5% total cases, and efficiency of this route is 30% without treatment, with treatment less than 1. So now, if you have a low risk infant, let me first make it here, okay? Suppose you have a low risk infant. So if I talk about okay, let's make it here only, low risk infant. Low risk infant का मतलब होता है mother is on ART or at least she has taken ART for more than 4 weeks. Also, low viral load is detected after 32 weeks of pregnancy. In this case, we will give either nevirapine or zidovudine, but we prefer which one? Nevirapine. Whether she is breastfed or exclusive replacement feed, it is done till 6 weeks. ठीक है, but high risk infant means mother not on ART, okay, not on ART, or she has taken ART for less than 4 weeks, or we can say viral load is not suppressed even after 32 weeks. The load is not suppressed. We are going to add both nevirapine also, zidovudine also. In case of exclusive top feeds, it is given for 6 weeks. Breastfeeding, it is given till 12 weeks. Also, please remember, mother to child transmission में no mix feeding allowed, okay? No mix feeding, no mix feeding. That means कभी breast milk पिला रहे हैं, कभी top feeds. ये allowed नहीं होता है. Is it clear? Everyone, mother to child transmission of HIV. So here it was a low risk, high risk infant. So we had given both syrup, nevirapine, zidovudine. Since the baby was on exclusive replacement feed, it was given for 6 weeks. Okay. Now over here, please remember, whenever a baby is born to a HIV positive mother, okay, HIV positive pregnant female, what is the drug of choice? Anybody, quickly. HIV positive pregnant female. Let's discuss a couple of questions here. HIV positive pregnant females. What is the drug of choice? It is TLD, tenofovir, lamivudine, dolutegravir, irrespective of gestational age. Okay, irrespective of gestational age. ये भूलना नहीं है. And बच्चे को, how will you test a newborn? How will you test a newborn? Will you do a ELISA? Will you do a Western blot? No, you will do a DNA RT-PCR for a newborn. Newborn में कभी ELISA Western blot मत करने बैठ जाना, ठीक है? And early infant diagnosis is done at birth also. It is also done at 6 weeks. Confirmatory testing is 18 months. For opportunistic infections, cotrimoxazole to prevent pneumocystis carinii pneumonia. ठीक है. Accidental needle prick injury. Anybody, what is the drug of choice? Accidental needle prick injury. Can you tell me? Accidental needle prick injury. What is it that we are going to take? अगर accidental needle prick injury हो गया, please remember it is again TLD given for 28 days. It should be given within 72 hours, given within 72 hours, and best if started within 2 hours. Best if started within how many hours? 2 hours. ठीक है, the sooner the better. Remember these couple of points. Okay, moving to the next one. Treatment of paucibacillary leprosy consists of MDT. Latest recommended regimen. So wanted to discuss that, although you will be discussing it in pharma also. This is the leprosy program logo. इसका नाम क्या है? National Leprosy. What is the name, everybody? Eradication Program. Don't say elimination. Eradication Program. And currently करंटली लेप्रेसी इंडिया से क्या है, करंटली लेप्रेसी जो है इट इज एलिमिनेटेड फ्रॉम इंडिया, ठीक है। व्हाट इज द एलिमिनेशन क्राइटेरिया, यू शुड नो प्रेवलेंस रेट लेस than 1 case per 10,000 population. If I do a survey of 10,000 population, I should not find even a single case. Current prevalence of leprosy is 0.45. ठीक है। Now from April 1, 2025, 3-drug regimen was proposed for POSI also and multibacillary also. So what is it that you have written? Very good. For POSI bacillary, the duration of treatment is 6 to 9 months, 3-drug. Now let me just quickly discuss what is the newer guideline to differentiate POSI bacillary and multibacillary. Who's going to tell me POSI bacillary and multibacillary if I talk about PBL and multibacillary? Okay, so what is the differentiating guideline, guys? In terms of skin lesions, for POSI bacillary, everybody, how much is the skin lesion? 1 to 5. Multibacillary more than 5. Okay, more than 5. Okay, when I talk about nerve involvement, POSI bacillary no nerve, multibacillary more than equal to 1 nerve. And to initiate MDT, we can rely on these through. Okay, MDT, if you want to initiate MDT, you can rely on these two. Skin smear examination, if you talk about skin smear, this is negative at all sites, negative at all sites. Okay, but for multibacillary it is positive at one or more sites. यहाँ पे क्या है? Negative. And we all know 3-drug regimen है. For POSI bacillary, duration is 6 to 9 months. For multibacillary leprosy, the duration is 12 to 18 months. And what is the drug which is only given as monthly supervised dose? What are the 3 drugs that we give, guys? I hope you all know. We give rifampicin, we give dapsone, we give clofa. Okay, clofa. But rifampicin is only given as monthly supervised doses. Okay, monthly supervised doses. A couple of points that you should know. Yes, most commonly involved nerve is ulnar nerve thickening and enlargement हो जाता है. Hypoanesthetic patches देखने को मिलती हैं, ठीक है? So you should know that. ASHA is, ASHA has been given a special term, ASBULS. If ASHA is detecting a case of leprosy, the special term is ASBULS, ASHA based surveillance of leprosy patients. If she is able to detect a case of leprosy without disability, she gets 250. And if she is able to detect a case of leprosy with disability, she gets rupees 200. Okay. Alright, these are certain other pointers that you should know from leprosy program. Most important epidemiological indicator if you talk about is annual new case detection rate for leprosy, which should be less than 10 cases per 1 lakh population. Okay, operational indicator grade 2 disability, and also health awareness indicator is grade 2 disability, because leprosy बहुत आने का chance है. And when are we talking about a leprosy Mukt Bharat? Anyone in the comment section? Leprosy Mukt Bharat, we are aiming by which year, guys? 2027, a very important year, 2027. We want a leprosy Mukt Bharat. We also want to eliminate filariasis. We also want to eliminate Kala-azar. ठीक है, filariasis भी Kala-azar. ठीक है? Okay, moving to the next one. Let's see if you can answer this. Following campaign detected in the image was launched to spread awareness about which of the following? Yeah, good. This is child's right. ये क्या है? This is Meena. Okay. Meena again was a concept by UNICEF to spread awareness on leprosy, on child's right, empowerment of children. Okay. So you can see that she is flying. None of her rights are being violated. She is flying. Now the concept of Meena was such a hit that India adopted this concept in the form of ये कौन है? Who is this? This beautiful looking girl, this sweet little girl. She is Sapna. Sapna is with a, she is Sapna. She is Meena. Meena is flying high. She is Sapna. Sapna is with a school bag. Please remember, Sapna एक cured case of leprosy थी, ठीक है? She was a cured case of leprosy. Then she was used as a mascot, Sapna mascot. Under which initiative? Under Sparsh initiative. Under Sparsh initiative. To spread what? Under Sparsh initiative to spread awareness on leprosy. Spread awareness on leprosy. Okay. So Sapna concept came under the Sparsh initiative to spread awareness on leprosy. ये भूलना नहीं. Okay. Meena and Sapna. Sapna के पास school bag है. Alright, moving to the next one guys, which of the following group of individuals is not targeted under the program? तो ये किसका लोगो है? देखो आपने TB प्रोग्राम का लोगो you saw NCD program logo, you saw leprosy logo. Leprosy program logo is highly expected. This red color ribbon, if you see, it resembles HIV/AIDS. Actually, the program ka logo is like this. NACO with a red ribbon. Headquarter is in New Delhi. Okay, and industrial worker is not a part of it. Now, why have I given you this question? It was asked in NEET PG, it was asked in INI-CT also. What are the high risk groups for HIV? Anybody? High risk groups, or I could say the core groups. High risk groups or the core groups for HIV? Batao, there are only 4 core groups for HIV guys. Commercial sex workers, they will not write the full form. MSM, men having sex with men. Okay, then IDU, injectable drug users, and also TGs. TGs means transgenders. All right, these are the core groups. What are the bridge populations? Those that connect the general population to the high risk groups. So bridge population. Bridge population, you will have single male migrants, okay, single male migrants. Also you can have everybody, the truck drivers, single male migrants, truck drivers. Also you can have clients of sex workers. And other than this guys, if I have to find out about HIV prevalence, what is the type of surveillance that we do? Know the name of this surveillance. The name of this surveillance, everybody, is sentinel surveillance. I am not going to go into too much detail. This is done once in 2 years. Okay, so biennial karte hain. Okay, once in 2 years, and we look at the prevalence of HIV among ANC females and use it as a proxy indicator for the general population. Okay, one slide, a lot of information to take in. Okay, all are true about the following except, now this is one life cycle that we can expect in exam. So which life cycle is this? This here I have shown you the life cycle of Japanese encephalitis. The vector for JE of course is Culex. Okay. Now over here pigs are amplifying host. True. Are-died birds are natural reservoir? Yes. Man-to-man transmission? No. Man-to-man transmission kabhi nahi hota hai. Please remember, it is the accidental host or the dead-end host. And horse are the only animal which shows symptoms. JE vaccine we will discuss in a little while, but this life cycle you should revise and go once. Alright? Okay, let's read this. Which epidemiological concept represents that individuals with high blood pressure during childhood continue to have high BP in adulthood, while those with low blood pressure in childhood tend to maintain low level later in life? This is what tracking phenomenon. Okay, so we have discussed this many times. If you follow up a person from childhood to adulthood, if the blood pressure is low in childhood, it will remain low in adulthood. If it is high in childhood, it will remain high in adulthood. Please don't say BP increases with age for tracking phenomenon. No. Okay, hypotensives, tracking phenomenon में क्या होता है guys? Hypotensives, this is the logo. Hypotensives remain hypotensives. Okay, hypotensives. This is childhood and this is adulthood. And hypertensives, what happens to them? They remain hypertensives in adulthood. Clear? So this again is important. Next one, what is this? What is depicted by number 2 image? In the by number 2 in the image. This is rule of halves. Tell me what is number 2. Want a break? Let's first see a couple of more questions. Okay, what is depicted by number 2 in the image representing? ध्यान से सोचो. First of all, don't memorize this. Okay, now 1 2 3 4 5 6 7 8 9 9 एग्जाम में आ चुका है. This one is adequately treated. Okay, this one is adequately treated. Okay, now what is rule of half out of all the hypertensive? So let me straight away take you to this image. Okay, now what is rule of halves? This is the explanatory slide. Rule of halves क्या बोलते हैं? Out of all hypertensives, okay, out of all hypertensives in a community, 50% subjects are aware of the condition and only half of those aware are being treated, and only half of those being treated are considered to be adequately treated. Now see, this one, guys, is whole community, this outer line. This 2 is the normotensive subject, okay, but if you have to see 3, ये outer line याद रखना है तुमने. This is out of the whole, the hypertensives one. But what is 4? This is 4 undiagnosed hypertensions. What is this 5, guys? This in a row, they are diagnosed hypertensives. What is 6? Diagnosed but untreated. What is 7? Diagnosed and treated. What is 8? Inadequately treated. What is 9? Adequately treated. You should know actually these, at least these outer circles for your exam. So I have labeled it. You will find it in the PDF also. So here I asked you number 2. So number 2 over here was what? Normotensive subjects. In case you've not yet done this, please go through this rule of halves. Labeling can be done. Okay, one more thing, guys. Dash diet किसके लिए होता है? I hope you remember the full form of dash diet. Dietary approach to stop what? What is dash diet? Dietary approach to stop everybody hypertension. ठीक है? Hypertension. Okay, minimum number of antenatal visits, a quick 30-second question है, 10 second में answer लगाओ. As per WHO, the minimum number is 8. As per GOI, the minimum number is 4. But suppose there is a question in which they don't give you WHO or GOI. But if you see the option as 4, you will go for that, okay? Because Government of India 4 बोलते हैं. And if I talk about the ideal visits, ideal visits is always 13 to 14. I mean, how many visits she should do? 13 to 14. और ये जो 8 है ना, ये you should know, first trimester she is supposed to make 1 visit. Second trimester, everybody, she will make 2 visits. And if I talk about third trimester, she will make 5 visits. So don't mess up this. Number of visits बहुत बार पढ़ चुके हैं. Okay, next question. An unvaccinated 5-year-old child presents with a sore throat and difficulty in swallowing. On examination, she has a grayish membrane over her tonsils. She has a fully vaccinated 2-year-old brother who was asymptomatic. I only wanted to discuss contact management and diphtheria. You all know grayish membrane, the pseudo membrane, you should never remove it. So here we are talking about diphtheria में contacts का management. बताओ, what is it that you're going to do? No intervention, booster dose, single dose, prophylactic dose of immunoglobulin, prophylactic dose of penicillin. Good that we've come up with this question, guys. Only one person so far has given the answer correct. Mansuri, I guess. Alright, some of you are also giving correct. Okay, let's see. पढ़ लो इसको. Okay. I'm not discussing the management of cases. I'm discussing the management of contacts. Okay. All households contacts of diphtheria closely monitored for 7 days. Culture taken from throat and nose. Antibiotic prophylaxis, penicillin or erythro. We prefer penicillin. If resistant, we'll go erythro. Regardless of immunization status. ये तो देना ही है. Whatever is the immunization status, this has to be given. Now, what about immunization status? If fewer than 3 doses of diphtheria toxoid are given or vaccination history is unknown, if the child has taken, the contact has taken less than 3 doses, or we don't know whether the contact has been vaccinated or not, we will immediately give the vaccine, diphtheria toxoid, and primary series completed according to the current schedule. If more than 5 years have elapsed since administration of diphtheria toxoid containing vaccine, only booster dose given. If most recent dose within 5 years, no booster dose. Okay, if 5 years have elapsed, then only we'll give a booster dose. If it is taken within 5 years, no booster dose. At last, 2 successive negative cultures obtained 24 hours apart after completion of therapy has to be taken. All right. So over here, what was the question, guys? She has a fully vaccinated. So her the child's immunization status is complete. Okay. But irrespective of the immunization status, for any contact, what do we have to give? We have to give a prophylactic dose of penicillin. Is it clear? Irrespective of the immunization status. What was written over here? Regardless of that, you have to give this one. ठीक है, thumbs up. Diphtheria management हो गया, rabies हो गया, pneumonia हो गया, diphtheria हो गया, STD हो गया. Next one. Let's go to a quick revision of some biostats question. Ready, everyone? In a survey of sleep apnea scores among 10 persons, the highest value of 58 was wrongly recorded as 85. This will affect the final result as. Now, what is this? So, we all know, guys, mean kya hota hai? Mean is the sum of all observations. It is sum of all observations. Sum of all observations divided by the total number of observations. Okay, sum of all observations divided by the total number. And what is median? Median is the middle value. Middle value. But you have to arrange in ascending order. Don't forget to do this. Suppose if I have to give you 2, 1, 3, 1, 2. What is the median in this case? Please don't say 3. You have to first arrange 1, 1, 2, 2, 3. So what is the median? The middle value, 2. Now over here, the number of observations is 5. 5 क्या होता है? Odd number. So what is the median over here? Middle value. But suppose it was 2, 1, 3, 2, 1, 3, 1, 2. Now here what is the number of observations, guys? 6. 6 क्या है? Even number. So we will have to arrange in ascending order like this. Now what is the median? Which 2? So in even number of observations, what are you going to do, everyone? You will take the average of the two middle values. Do not forget this, guys, how to calculate median. You can get in your exams. Now over here what happened was highest value of 55 I recorded as 85. So if I have to calculate the mean, I will be adding everything, and instead of adding 58 I am adding 85. I should have added 58. So numerator will increase. So what will happen to the mean, guys? It will increase. But suppose मुझे इसका median निकालना है. I will arrange it in ascending order like this. And 58 is the highest value. So it will go at one end. Now even if I have written it as 85, it is still at the same, at one corner. So median is what? The middle value. It didn't get affected. So what is going to happen over here? What is going to happen over here, everybody? There is no change in the median. All right. Yeah, sorry. It should be increased mean. So sorry, everybody. Increased mean, but no change in the median. Okay. एक bonus mark. I've given you one bonus mark. Okay. A typo error हो गया. Sorry for that, guys. It should be increased mean and no change in the median. And what are these? So I hope you remember, statistically, what is the best measure of central tendency? Mean. But when you have outliers in your data set, उसको क्या बोलते हैं, guys? A skewed observation. Outliers are too high or too low values. So here this was an outlier. And when you have a skewed observation, the best measure of central tendency, everybody, is median. ठीक है? Confused नहीं होना. All right, let's do a calculation over here. Who's going to do this? In a group, the mean blood glucose level is 105 with a standard deviation of 10. Assuming a normal distribution, what is the expected range of blood glucose values for 95% of population? So over here, for normal distribution, we all know mean plus minus 1 SD covers 68% observation. Mean plus minus 2 SD covers 95% observation. Mean plus minus 3 SD covers how much? 99%. So here I have to find 95%. So what I am going to use? This one. What is the mean, guys? 105 plus minus 2 into standard deviation is 10. 2 into 10. So what is it? 105 plus minus 20. So what is it going to come, everybody? What have you written as your answers? 105 minus 20 हो गया 85, 95 और यहाँ पे हो गया 115, 125. So this is your answer. It's a simple question based on these values, so don't make a mistake over here. Also, for a normal distribution, I hope you remember, everybody, mean is equal to 0, mean is equal to 0 and standard deviation is equal to 1. Okay? Okay. Going to the next one. Oh, before that, can anyone tell me, suppose mean is more than, median is more than mode, what is this called as? मीन इज मोर देन, मीडियन इज मोर देन मोड, इसको क्या बोलते हैं? मीन इज मोर देन, मीडियन इज मोर देन मोड, मीन इज 500, मीडियन इज 300, मोड इज 200, इसको क्या बोलते हैं? मीन इज मोर देन, मीडियन इज मोर देन मोड, गाइज राइट साइडेड स्क्यूनेस, पॉजिटिव स्क्यूड, वेरी गुड. एंड मीन इज लेस than, median is less than mode, everyone, this is what? Left sided skewness. So you should not get confused in this. They can give you 4 values and accordingly you have to figure it out. Okay, chalo, moving to the next one. Test of statistical significance is highly expected this time. It is a repeat from the NEET PG question also. So let us look over here. देखो, first of all, I want you to master the approach. Now, to master the approach, guys, you have to first figure out, wait, don't be in a rush. Listen to me once, okay? Are you talking about a quantitative variable? Are you talking about a qualitative variable? Now, what is quantitative? Quantitative hota hai measurable. And what do I mean by measurable? Something that has a unit. Qualitative is what, guys? Non-measurable. What do you mean by non-measurable, everybody? No unit. You can count it. You can count it. It is countable, but you can't measure. Like suppose I take height, weight, hemoglobin. All of these you can measure it. Okay, you can, they can be measured. They have a unit. But suppose I ask how many boys in the class. Can I measure gender? No. Can I measure religion? No. I can count how many people of X religion, Y religion. Can I, disease. Can I measure any disease? No. We can't measure hypertension. We measure blood pressure. हम लोग blood pressure को measure करते हैं. हम लोग hypertension को measure नहीं करते. हम लोग hemoglobin को measure करते हैं. Anemia को measure नहीं करते. So whenever your first thing that you have to do is figure out quantitative or qualitative. Now, if it is quantitative, what is the test that we will use? Parametric. If it is qualitative, what is the test that we will use? Non-parametric. First of all, you need to know that. And I've taught you. Parametric tests are based on alphabets, okay, alphabets. And non-parametric test, everybody, are based on what? Non-parametric test, everyone, is based on fancy names. Okay? Now, once you figured out this, you have to see, is it one group, is it two group? It is more than two groups. So, if you have one group, parametric, all right, let me take you to a chart over here. Wait, 1 second. Look over here. If you have one group, okay, if you have, this is parametric and this is non-parametric. Now, if you have one group before and after intervention, one group before and after intervention, guys, what are you going to use? Paired. If you have two groups, what are you going to use? Unpaired. If you have more than two groups, what are you going to use? ANOVA. This is scatter diagram, all right? This is what is represented by scatter diagram. But if you have non-parametric tests, they are all fancy names. So, for one group, if you have, we will use Wilcoxon sign rank, mostly. So, names are all fancy. But remember one thing over here, chi-square test is the one which we most commonly use for two groups and also more than two groups. Okay? So, what I'm trying to tell you, first figure out the variable that we are talking about. So, let's go back to the question over here. See, you had to check SIDS. Now, what is SIDS? SIDS is a disease. Can you measure SIDS? No. You can count SIDS. How many children suffered from SIDS? So, this is which type of variable, everyone? qualitative. So if it is qualitative, I will not use this one, I will not use this one. Now I have to see how many groups are there. Summer season, June to July, August to September in another group. So how many groups can I see over here, everybody? 2 groups. So 2 groups, qualitative variable. What is the answer over here, everyone? chi-square टेस्ट. मॉरल ऑफ द स्टोरी, पहले आपको यही फिगर आउट करना है, आर यू टॉकिंग अबाउट अ क्वांटिटेटिव वेरिएबल और अ क्वालिटेटिव वेरिएबल. इज इट क्लियर? गिव मी अ थम्स अप, गिव मी अ थम्स अप ओवर हियर. Just a second, everybody. Now look at this second question. Let's do biostats question, then I'll give you a 5 minutes break. Okay, I want to finish those 100 slides first. So we are on the 86th one. Let me go to the 100th slide, then I'll give you a 5 minutes break. Okay. अब इसको करो. There is a group of 200 hypertensive patients. First group of 100 patients is given medical advice, whereas second group of 100 patients is advised lifestyle changes, which is used to compare blood pressure. Now, what is the variable? Is it quantitative or qualitative? Which type of variable are we talking about, guys? Look at the variable. You can measure it, okay? This is measurable. So, since it is measurable, it is quantitative. It has a unit, mmHg. So now I will not use these fancy tests. Now I have to see, is it one group or is it more than 2 groups? So I had 200 patients, but I divided them into 100 patients, Them I put on medical advice and them I put on lifestyle changes. So I have 2 groups over here. So what am I going to use, everybody? Unpaired t-test. Okay, again, moral of the story, first you have to see quantitative hai, qualitative hai. Look at whether it's one group, 2 group or more than 2 groups. Suppose, tell me the answer to this. What test will we use to compare hemoglobin level in a group of alcoholics, before and after treatment? क्या होगा इसका आंसर? Before and after treatment. What is it? What is your answer over here? Which test will you use to compare hemoglobin in a group of alcoholics? Now again, hemoglobin is quantitative, so we will use parametric, and there is just one group, before intervention, after intervention. So what is the test we are going to use over here, guys? Paired t-test. Clear? So again, look at the variable of interest, figure out the number of groups. Quantitative measure कर सकते हो, qualitative को measure नहीं कर सकते. This will be there in the presentation. You can go through it, difference between quantitative and qualitative. And this also will be in the PDF. All the fancy names that you should know, guys, are qualitative and rest of them are means non-parametric. Mostly in FMGE exams, you will be getting the interpretation of t-test and chi-square test. Okay, all right, tell me the answer to this one. The following diagram charts the population changes over years, with statistical diagram is used here. So what is it? Now as you can see, anywhere where we have a gap is a 3-letter word, bar is a 3-letter word. This is what a single column has been divided into different segments. So this is a component bar. Bar always represents frequency of which variables, guys? Qualitative, gender, religion, all those things. Qualitative, or I could also say discrete variables. So there are different types of bar diagrams, guys. Wherever you will see a bar gap, जैसे यहाँ पे आपको gap दिखा, so this is which diagram? This is a simple bar. Here you see gap. Although you have joint columns, but then you have gaps. This is what, guys? This is a multiple bar. And over here, what is this? This is a component bar. But what is a histogram? If you see, this is a histogram. Histogram क्या represent करता है? Histogram represents the frequency of which variables? It represents the frequency of everybody. Quantitative variables, okay? There is no gap. Continuous variables, age, hemoglobin, height, weight, all those things. And when you join the midpoints of these columns with straight line, this is what is formed. This is known as a frequency polygon. Okay, you join the midpoints by straight line. What is this known as? This is known as frequency polygon. I'm drawing an image. Tell me, what am I drawing? One second, okay? I'm drawing an image. What is this? What is this? Now what am I trying to show? This one is a line chart, guys. Line chart क्या represent करता है? Incidence of a disease with time, constant incidence of a disease, trend of a disease with time, okay? And ogive is something which is constant increase, cumulative frequency. अगर आपको ये word दिखा एग्जाम में, cumulative frequency means over here ogive. Ogive means, like, suppose I want to represent recurrent TB cases, okay? So over there it is ogive. There is absolutely no dip. Clear? So these are certain images that you should know for your exams as well. Oh, before we go that, one more thing I wanted to discuss. Tell me something. Tell me. All right. Tell me the formula for standard range. First formula. What is the formula for range, everyone? Let's revise this. What is the formula for range? I hope you remember maximum minus minimum. Tell me the formula for standard deviation, everybody. Tell me the formula for standard deviation. Square root summation mu I minus mu whole square by n. Standard deviation, if sample size is less than 30, is highly expected. Standard deviation summation mu I minus mu whole square by n minus 1. What is standard error of mean, everybody? Standard deviation upon square root of n. What is coefficient of variation? Standard deviation upon mean into 100. And what is variance, guys? Variance is standard deviation square. I want you to go through these formulas for exams, guys. Question दे देंगे, standard deviation is 5. Calculate variance. All you have to do is 5 into 5. Question दे देंगे, maximum weight of a student in the class is 100 kg. Minimum weight is 50 kg. Calculate the range. Standard deviation, of course, you can be asked to identify this formula. ठीक है? Alright, moving to the next question. Which of the following is not a characteristic of common source epidemic with a single exposure? Can you tell me? The epidemic curve shows a rapid increase and decrease in cases. Cases are spread across multiple incubation period of the disease. Epidemic often appears as explosive outbreak with cases clustered quickly. Single tall peak with no secondary waves. So what is this, guys? A quick discussion over here. ये होता है ना? Rapid rise, rapid fall. Are the cases spread over multiple incubation period? No, they are spread over single incubation period. ठीक है? And since cases are clustered over single incubation period, clustering of cases within a single incubation period, so it has a single peak. It is explosive in nature. No secondary waves. Very common example of this, guys, is kaun sa? Food poisoning. Also the tragedies that we had, Bhopal gas tragedy. So you can get this in exams. For you, I have given the pictures also for you to revise. Ye ho gaya tumhara rapid rise, rapid fall. This is single exposure epidemic. What about this one? What about this one? Over here, in this over here, the source is common, but ये कैसा exposure है, guys? This is continuous exposure, or I could also call it as multiple exposure. Here cases बहुत धीरे धीरे बढ़ते हैं and they spread over multiple incubation periods like this. So you can see there are multiple peaks, right? For your exam, 3 examples. It has to be on your tips. Number 1, commercial sex worker are examples of common source continuous exposure. Contaminated well आ सकता है exam में, contaminated well, and also infected milkman. Okay, also infected milkman. These 3 are examples of this one. Okay, this image has come in your exam, propagated epidemic. Propagated epidemic follows person to person transmission. Okay, epidemics of hepatitis A as well as polio. Here you can see there is a very tall peak. Here also, guys, cases occur over multiple incubation period. But यहाँ पे बहुत ही छोटा सा plateau phase होता है. And to make things easy for all of you guys, this is the table that you should remember. Single exposure, continuous exposure, as well as propagated exposure. This will be there in the PDF. You must go through this PDF before your exams. This example. ठीक है? All right, the next one, a group of experts delivered speeches one by one with no discussion allowed between them, and at the end, one person summarized the key points. Which mode of health communication does this represent, guys? COVID also propagated, basically that type of epidemic, okay? What is your answer over here? Group of experts, your buzzword, if they are like, let's say 4 to 8 experts, okay, 4 to 8 experts. One by one, no discussion allowed between them. So what is this no discussion allowed between them? It is symposium. What is the difference between panel and symposium, guys? Panel hota hai 4 to 8 experts, okay? But discussion permitted. Discussion permitted. Discussion. They keep discussing among themselves. In a panel, there is no set agenda, all right? There is no set agenda, no set speeches. Koi set speeches nahi hai. There is no set order of speaking. There is no set order of speaking. But when I talk about symposium, इसमें भी guys 4 to 8 experts होते हैं, ठीक है? We have 4 to 8 experts. But what is important over here? There is no discussion permitted, like here it is written, ठीक है? If you talk about lecture, please remember lecture is one way, rest all are Socratic. अगर एग्जाम में लिख के आया series of 4 or more meetings under an expert, what are you going to mark? Series of 4 or more meetings under an expert, guys. What is this? Tell me in the comment section. Series of 4 or more meetings under an expert. What is this? Series of 4 or more meetings under an expert. So what is the answer to this one? Who's going to tell me? Very good, Abdul. This is workshop. This is workshop. Series of 4 or more meetings under an expert is workshop. Okay, one more thing. Discussion among 6 to 12 participants. ये क्या है? Discussion among 6 to 12 participants. Look at the buzzword over here. 6 to 12. What is this? If you see the question, discussion among 6 to 12 participants. So what is this, everyone? This is nothing but FGD. 6 to 12 participants is a buzzword with FGD. Okay, focus group discussion. And if I have to teach someone, okay, Saran got it correct, FGD, yes. Most of you are writing FGD, great. And if I have to teach someone about ORS preparation, what technique should I use? ORS preparation, what technique should I use, guys? So for ORS and all, we should use what is known as demonstration. Okay? One-way methods are known as didactic, two-way methods are known as Socratic. All right, let's have a calculation in between. Can you calculate the risk ratio over here? Just wanted to revise a couple of formulas. Tell me the answer to this. A study was conducted over 15 years to evaluate the risk of mesothelioma among people working in the ship-based industry. The study included 200 workers exposed to asbestos and 300 workers not exposed. Seminar or conference, देखो conference बहुत macro level पे होता है. Seminar is like a conference but it is at a smaller scale. It is in a smaller scale. Like I can conduct a seminar with all the medical colleges of Delhi. Okay? Alright. So can anyone tell me what is risk ratio, guys? Again, don't panic. Like I've given you to calculate risk ratio. Where do you use a risk ratio? What is the other term for risk ratio, guys? It is nothing but relative risk. And where do you calculate this from? You calculate it from a cohort study. Now, as soon as you get this question, you need to try to, okay, I've got a question answer. Joy has come up. Jap Singh has come up. Very good, guys. Everybody. So we have to look at incidence among exposed. Okay, incidence among exposed divided by incidence among non-exposed. Okay, now here it is clearly written 200 workers are exposed to asbestosis. So how many workers? 200. Among them, how many developed mesothelioma? 40. Okay, and unexposed group. How many are unexposed, guys? 300. Out of them, how many developed? How many developed out of that? 5. 5 upon 300. So if you calculate, I'm sure it comes out to be 12, since most of you are writing it as 12. Now tell me, is it a risk factor or a protective factor, or it has no association? So whenever you have to do the interpretation of RR, I hope you remember RR more than 1 matlab risk factor. RR equal to 1 matlab no association. Alright, no association. And RR less than 1 matlab kya hota hai guys? Protective factor. Don't forget, RR is something that you can get in your exams. A, B, C, D. Okay, this was Z. And if somebody asks you what is the formula for attributable risk, what is the formula for attributable risk? So it is a difference. Incidence among exposed minus incidence among non-exposed divided by incidence among exposed, and we will always multiply with 100. Okay? So attributable risk and relative risk can come in your exam. Attributable risk is a risk difference between exposed and non-exposed. Okay? Clear? Panic nahi karna. Anyone in the class can tell me the formula for odds ratio, guys? What's the formula for odds ratio, if you remember? Odds ratio is a cross product ratio. So what is it? It is AD upon BC. And similarly, ABCD, odds ratio more than 1, equal to 1 and less than 1. Okay? Odds ratio you will calculate from which study design? You will calculate from a case control study design. Okay. Now tell me the answer to this one. Which of the following indicators is used to calculate both HDI and PQLI? So out of these, this is a NEET PG PYQ got repeated again, guys. NEET PG PYQ. Which indicator, which out of the following is used in both HDI calculation as well as PQLI calculation? Yeah, I will give you a 5 minutes break. Just a minute, everybody. Okay, so over here, I hope you all remember, if you talk here, you have two things, PQLI, HDI. What have I taught you? Ill. ठीक है? What have I taught you? Ill. अब मुझे mixed answers मिल रहे हैं इसमें. Something which is common, infant mortality rate, life expectancy at age 1, and what is this? Literacy rate. And what have I told you? If somebody is ill and you don't treat him, वो kill हो जाएगा. ठीक है? So what is K? Knowledge index or education index. Knowledge index or education index is reflecting literacy only. In this you have mean years of schooling and expected years of schooling. Then HDI, development cannot happen within income, gross national income. Gross national income is the one that represents what? Standard of living of country. And this is what, if you're talking about development, let's look at it right from birth. So life expectancy at birth. Now what is it? What is the common thing that you see over here? Some of you are writing life expectancy. Life expectancy मैंने लिखा है birth. Birth तो यहाँ पे है ना, only in HDI. In PQLI it is at age 1. Gone. Some of you are writing IMR. IMR is only in PQLI. Gone. Standard of living is only being reflected by HDI, guys, because income is only a part of HDI. But literacy is something which is common in both. Did you understand how they can twist you with the question? You had to find out which is common. Now, every time we study PQLI and HDI, but this is how you can be tricked. PQLI की scoring 0 to 100 होती है, HDI की 0 to 1. Current score of India HDI 0.64 and rank is 134. HDI concept is given by United Nations Development Program. Okay, standard of living can be compared using HDI. That is okay, but this is how they trick you in the exam. Okay? One more indicator, tell me the answer to this. This is again a expected PYQ. Global Hunger Index. 2 countries, yes, of course, Joy. 2 countries can be compared using standard of living, because standard of living includes income, as you saw over here. I mean in income, and income is an indicator in HDI. Alright, what is the answer over here? Does not include, don't be in a rush, does not include IMR, okay, does not include IMR. So all this is a part of Global Hunger Index. We have done this many times. Imagine a child who is like seen on the streets. He appears very weak, very thin. So he's not getting enough food, inadequate food supply. This is what proportion of population undernourished. It reflects undernourishment. Now because he's not getting food supply, undernutrition हो सकता है इसको, wasting and stunting, and ultimately under 5 mortality. The children on the street just don't belong to 1 year. They could be up to 2 years, 3 years, 4 years, 5 years also. So under 5 mortality. Yeah, that's your global hunger index. Okay. Now let's do a couple of entomology images in 2 minutes span. ये क्या है? Water from a stagnant drain is collected in a container and observed for breeding mosquitoes. Image of the larva is shown. Whose larva is this? Highly expected. Highly. या तो इसका larva या किसी और का आएगा. This has a longer siphon tube. When I say a longer siphon tube or a breathing tube, it is Culex. Which one does not have a siphon tube, guys? Anopheles. No siphon tube. Aedes we have to talk about is a shorter siphon tube. Okay, so longer siphon tube is in Culex. Now look over here in the image. I have made you revise also. You can expect an image like this. ठीक है, पानी में ऐसे parallelly अगर कुछ rest कर रहा है, parallel to the water surface, that is Anopheles. But Aedes, it has a smaller siphon tube. Culex, it has a longer siphon tube. Siphon tube का question exam में आ सकता है. अभी मैं सब करा दे रही हूँ. Now these are the eggs, guys. Okay. Now for the eggs, you need to revise a couple of things. I've told you Anopheles is a sophisticated mosquito. It likes to breed in clean water. So it likes to go alone on a boat ride. How are the eggs of Anopheles? They are like this. Okay, boat shaped, single boat shaped lateral floats. Boat shaped with what? Lateral floats. Okay, boat shaped with lateral floats, and they are laid single. Okay, Aedes. Now Aedes is because of artificial collection of water, and we are letting water collect here and there. Okay, and in that sense, remember. So Aedes का eggs ऐसा होता है, cigar shaped, single. Okay, likes to lay its eggs single. But this one over here, Culex. Culex is a nuisance mosquito, breeds in dirty water, lays its eggs in cluster. Okay, so this is what? This is clusters. Eggs are in clusters. Okay, you should know the difference between these types of eggs. And of course, how are you going to identify the adult mosquito? I will show you a table which has a comparison. Abhi bas sun lo. Hunchback, white stripes on black body, white stripes on the body. This one over here, guys, is Aedes. Okay, hunchback but no white stripes. Short body, long legs. This is Culex. This crawling over up on the surface, ऊपर की तरफ जा रहा है, Culex. But 45-degree angle with spotted wings. This is what, guys? This is nothing but Anopheles. ठीक है? This is nothing but Anopheles. And if you look at this one, large body, large legs. Okay, this is Mansonia. Mansonia क्या transmit करता है? Brugian filariasis और Malayan filariasis. ठीक है, large body and long legs. So you could also get the images, these 3 images. अब ये देखो, this is a hunchback, short body, लंबे लंबे पैर हैं इसके. This is what? This is Culex. Another image of Culex can come, short body, long legs. This is what? Culex. But what is this one? This one over here is hairy wings, guys. This one over here is hairy wings. So if you see hairy wings, what is your answer? Please don't say machhar. This is what? Sandfly. Okay, phlebotomous argentypes. Don't mess up these things. And to make things clear, I have retained the PDF में a difference of table between Anopheles, Aedes, Culex and Mansonia. If you ever see the word overhead tanks, it is Anopheles. If you see the word long-standing water collections, it is Culex. Under aquatic plants, it is Mansonia. So what we just discussed now, it is given in the table. So you should and must revise this table before you go to the exams. Okay. Also, I have written the flight range. These are couple of things that are important, can come for your exams. ठीक है? Alright, now let's talk about this one. Pregnant women in 3rd trimester. Now यहाँ पे एक update है I wanted to share with you. What is the answer? A pregnant woman in the 1st trimester having fever was diagnosed as a case of falciparum malaria. Under the health program, which drug is recommended? What are you going to mark? guys. I think you can just quickly go grab a cup of tea and coffee, and 5 minutes, whatever you miss, you can see it. You know, let's not break the session in between. It maintains the continuity, right? So फटाफट से चले जाओ, chai, coffee, anything that you can get, and let's continue with the session. Okay, pregnant woman. A pregnant woman in the first trimester having fever was diagnosed as a case of Plasmodium falciparum malaria. Which drug is recommended? Under the program, guys. Program में कोई change नहीं है. Okay. So let me tell you. Plasmodium falciparum. Okay. Ideally, the drug of choice is ACT. Okay. ACT. If we talk about other states, everybody, ACT SP. If we talk about northeastern state, ACT LM, plus we will add Prima, Queen. But now here the question is pregnancy. अब ध्यान से सुनना, okay? Plasmodium falciparum in pregnancy, everybody. According to the program I am talking about, if it is the first trimester, abhi I am talking program. If it is the first trimester, it is quinine plus Clinda. Okay, but if it is the second या third trimester, okay, then it is what? ACT. And other states it is going to be ACT SP, and northeastern state it is going to be ACT LM. And like somebody has written, no Prima, no Prima. ये वाला था non-pregnant state, the one that we discussed, non-pregnant state. So according to the program, in the first trimester, quinine and clindamycin. But as of latest WHO का एक guideline आया, okay? WHO guideline has come latest. WHO guideline के according, in the first trimester, for Plasmodium falciparum, now they say ACT. It has been shown to be safe. Artemether, what are the things that we are going to give? Artemether plus lumefantrine. Artemether plus lumefantrine. Clear? What is the drug, everybody? Artemether plus lumefantrine. But unless and until it is asked, everyone, okay? Unless and until it is asked. जब तक कि आपसे एग्जाम में पूछा नहीं जाएगा, if they don't write WHO, you will not change it. You will stick to what the program says. Okay, you will stick to what the program says. But if they mention WHO, then of course it is ACT. Did you understand the difference, everybody? All right? No. Okay, so according to the program, first trimester, quinine plus clindamycin. But WHO के according, yeah. ठीक है. And what about prophylaxis? If I'm going for a short term travel, कौन सा drug मुझे दोगे? So here you have all the doses also. You can check it out later whenever you have time. I have written it for you. But tell me, if I'm traveling for short term prophylaxis, that means my travel duration, let's say, is less than 6 weeks. So A to D तक का distance short है, तो ये क्या हो जाएगा? Doxy. It is started 100 milligram का tablet है 1 to 2 days before travel and given up to 4 weeks post travel. But if it is long term prophylaxis, more than 6 weeks, A to M का distance long है, what is the drug you're going to put me on? You're going to put me on mefloquine, which is started 2 to 3 weeks before travel, and 250 milligram tablet and continued 4 weeks post travel. ठीक है? Treatment of malaria and prophylaxis is equally important. Okay, let's see another question. 38-year-old woman आई है, बिहार से आई है, presents with fever and unexplained weight loss over the past 6 months. Examination reveals massive splenomegaly and blood investigation show anemia, thrombocytopenia, hypergammaglobulinemia. What is the vector of the organism causing this condition? Bihar was your buzzword over here, okay? So here plus anemia हो गया है, thrombocytopenia हो गया है. So what are we referring to over here, guys? We are referring to Kala-azar, phlebotomous archetypes. Kala-azar is the same as visceral leishmaniasis. Two things that I want to discuss over here, guys, phlebotomous argentypes. Okay, phlebotomous argentypes. One thing, what is the diagnostic kit for Kala-azar, everyone? RK39. This is the diagnostic kit. Please don't remember, please don't forget this word. ये diagnostic kit है. और treatment क्या है? I hope you know LAM, single dose infusion of liposomal amphotericin B. ये buzzword याद रखना. ठीक है? Kala-azar also we want to eliminate till 2027. Okay. See, any person who comes with, fever, splenomegaly and is not responding to antimalarials, then you suspect Kala-azar. पहले तो हमेशा fever, splenomegaly, malaria ही होता है. चलो अगला आ जाओ. A region has a population of 6,000 people below 15 years, 12,000 between ages of 15 and 65, and 2,000 over 65. Calculate the dependency ratio of this population. So dependency ratio has to come in the exam. What question came in FMGE exam? A similar question came in INICT. So calculation of dependency ratio is important every exam. Children below, what is it? Below 15 years, okay, plus elderly beyond 65 years, everybody are dependent on the working class 15 to 64 years. Now you had to see, okay, ma'am ने दिया है 6,000 people are below 15 years. यहाँ पे आ गया. 12,000 are between ages of 15 and 65 years. And 2,000, so ये 2,000 यहाँ पे आ गया. And this 12,000 is coming over here, everybody. Okay, so since it is ratio, it is what? 8,000 upon 12,000. So you can very well easily do it. It will come to 0.66. But suppose they give you in the form of percentage. All you need to do is you will multiply with 100. अगर percentage के form में आ गया. ठीक है? They also came up with a question in FMG exam where they came up with a story that there is a man and a woman, 67-year-old man, 57-year-old wife. They have a son, 35-year-old, and son has a wife 25-year-old, and they have a child 5-year-old. So in that ways also they can give you to calculate dependency ratio. All that you have to remember is children below 15 years are dependents, young age dependency, more than 65 years are old age dependency. Okay. चलो, and if you remember, I'll just quickly write it, guys. What was demography bonus? किसको याद है? Bonus क्या था? Something good. So what is the good thing? Decline in dependency ratio. I'm not going to go into too much detail right now, but what is demography burden? Burden means the pressure. The pressure. What is the pressure over here? Increase in dependency ratio. Why? Because of increase in old age dependency. Why is here a bonus? Because of decline in young age dependency. Okay? So a couple of questions that could come in your exam. Okay, another numerical. Calculate secondary attack rate. Let's see who can do it. A couple has 4 children, all unvaccinated for measles. A child got measles on 5th of August 2015. 2 other children developed measles by 15th of August 2015. Secondary attack rate is. बोलो आंसर. आ गया आंसर. अब क्या है इसमें कैलकुलेट करना? सेकेंडरी अटैक रेट. वेरी वेरी इंपॉर्टेंट. ओके, सेकेंडरी अटैक रेट इज अ मेजर ऑफ communicability, or you could also say transmissibility of a disease. Okay, transmissibility of a disease. It's a measure of communicability or transmissibility. Now secondary attack rate का formula क्या होता है? Always multiply with 100. Number at the end I will sum up the multipliers for you today. Okay, number of secondary cases that develop following exposure to a primary case within one incubation period of the disease out of the number of susceptibles. Okay, now here 4 children, all are unvaccinated, so they are all susceptibles, guys. They are all susceptibles, but out of them on 5th of August एक बच्चे को measles हो गया. So ये क्या बन जाता है? He becomes the primary case. Now following exposure to him, 2 other children develop measles. So what are they, guys? They are the secondary cases. Now what is SAR? If you ask me, it is nothing but number of secondary cases, so that is 2. Now, what is the number of susceptibles? Is it 4? Is it 4? No. You have to subtract the primary case from the number of susceptibles. So, we had one primary case, 4 minus 1 into 100. So, this is 2 by 3 into 100. It will come around 66%. What I am trying to tell you, never ever forget to subtract the number of primary cases from the number of susceptibles. That you always have to subtract. You always have to subtract the number of primary cases from the number of susceptibles. In the exam, they could also write like 60% are vaccinated. Then don't get confused. If 60% vaccinated, matlab 60 क्या है? Safe है. Then how many are unvaccinated? 100 minus 60 are unvaccinated, guys. 100 minus 60, that will be 40, and they will become the susceptibles. Okay, that's how they can trick you in the exams. So, measure of communicability is secondary attack rate. So, I've made a table for you again over here that you should know. Crude death rate is the total number of deaths per 1,000 mid-year population. This is simplest measure of mortality. Proportional, this thing is most important mortality indicator of disease burden. Exam के लिए ये important है. Case fatality rate, it is a measure of virulence, guys. Okay. Survival rate is describes prognosis, particularly in screening techniques. Okay? So, these couple of things you can go through. Secondary attack rate, I have told you, is a measure of communicability. Two things that you should remember: communicability is secondary attack rate, virulence is, case fatality rate. Okay? All right. Going to the next one, let's see a couple of vaccines question in another 5 minutes. Give me an answer to this. An A&M worker has to conduct vaccination camp in a village. She received 2 open vials, one is Penta and the other is MR vaccine. Which statement is true regarding utilization of these vials? So, what is your answer? What is your answer, everybody? Now, you can see that she has, what is open vial policy? Once you open the vaccine vial, it can be used up to 4 weeks, okay? Provided it is maintained in appropriate cold chain, +2 to +8, vaccine vial monitor is not damaged, expiry date has not passed. So, over here, you have to know, okay, vaccines that do not follow open vial policy. What is it, guys? All reconstituted vaccines. If you remember, all which vaccines? All reconstituted vaccines. All reconstituted vaccines. So, what are they? If you remember, BCG. What is the diluent for BCG, guys? Normal saline. What is for measles and MR? Measles and MR, sterile water. Okay, sterile water. Then you have live J, guys. Live J, what is it? Phosphate buffer. Phosphate buffer. This is live J. And you have yellow fever. Yellow fever is what, everybody? Cold saline. So, these reconstituted ones, this one you have to use within 4 hours. This one you have to use 2 hours. This one you have to use half an hour. So, these do not follow. So, what are the vials that follow open vial policy? Vials that follow, okay, you should know. Vials that follow open vial policy. So, over here, it is nothing but all T series vaccine. All T series vaccine means they have letter T in it, plus PIO, PO, plus Japanese encephalitis killed follow करता है, ठीक है, not the live, killed. So, all T series means they have letter T in it. Please remember, earlier rotavirus was not following, but now rotavirus vaccine follows, okay, rotavirus. So, let me write over here, T series vaccines क्या क्या हो गया? Rotavirus, TT, TD, Penta, all of them follow, guys, DPT. All of them follow, ठीक है. PO से क्या हो गया? If I talk about PO, PCV, IPV and OPV, and also we have which one? Japanese encephalitis killed. So, over here she has received 2 open vials of Penta. So, she can use Penta, and what is it that she is going to discard? Measles, rubella, because they don't follow open vial policy. But in case in the exam the question was expiry date has passed, then you cannot use any of the vial. VVM has been damaged, you can't use any of the vial. Clear? So, don't make a mistake over here. Rotavirus अब follow करता है, live J does not follow, kill J follows open vial policy. Okay, true about VVM. What is VVM, guys? VVM is nothing but vaccine while monitor. So now you read each of this statement and tell me is it true or false. So vaccine while monitor क्या करता है? It monitors heat exposure. It tells us whether the vaccine has been damaged by heat or not. The cold chain temperature is +2 to +8. So it obviously monitors heat exposure. Indicates cumulative heat exposure, all right, as it gets added up. Does it determine vaccine efficacy? No, it does not directly determine vaccine efficacy. It indirectly measures heat, which measures vaccine efficacy. Okay. Can be used for expiry calculation? No, it has nothing to do with that. Expiry date can be changed? No. If the VVM is intact, expiry date has crossed, you will not use the vial. Discard if square is lighter than the circle? Never. If the inner square is lighter than the outer circle, what are we going to do? We are going to use the vial. So what is the correct answer over here, everybody? It is 1 and 2. So let's quickly revise vaccine vial monitor. So I hope you remember this image. This came in last NEET PG also. Inner square, you always have to compare inner square to outer circle. So this one you can use. Inner square is lighter than the outer circle. In the exam they can write inner square is white, outer circle is blue. Use. Inner square starts to change color but is still lighter. Inner square is light blue, outer circle is dark blue. Use. But inner square is the same color as the outer circle. Of course, don't use. And inner square is darker than the outer circle. Of course, you are not going to use. And which color bag are you going to dispose of these two vials, guys? कौन से color bag में dispose करोगे? Anybody. They are right now discarded. The vaccine vial, but they are not correct. Okay, they are discarded. They contain vaccine in it. No, if you have Kaverik has got it correct. Ayush has got it correct. Guys, ध्यान से सुनो. If the question comes, okay, vaccine vial. If the question comes, broken VV, they go into blue. Okay. But over here, this is discarded, guys. It has vaccine in it. So this is going to go into which bag? This is going to go into yellow bag. Don't get confused. All right. Okay. Now tell me this one, as per NIS, which vaccine are indicated at the first visit for immunization of a 13-month-old baby who has not been previously vaccinated? So he has come to you for the first time. So this is a case of what? This is the case of delayed immunization. So what are you going to give the baby? So you just have to remember a couple of simple things. In delayed immunization, what are the vials that you can give till 1 year? What are the vaccines that you can give till 1 year? So we can give BCG till 1 year, which is known as direct BCG. Okay, you don't have to perform tuberculin test. It is known as direct BCG. Also, if a BCG scar is not present, please reassure. No scar, don't revaccinate. What is it that you're going to do? If the tuberculin test is negative, we are going to reassure the mother. BCG, pentavalent, rota, penta-rota, IPV, PCV, all this can be given only till 1 year. What about till 5 years, guys? So till 5 years, we can give MR, we can give measles, we can give OPV, we can also give vitamin A. Vitamin A 1 ml or 1 lakh international unit. Thereafter, every 6 months till 5 years, 2 ml or 2 lakh international units. What are the vaccines we can give till 7 years, guys? DPT. And what is the vaccine we can give till 15 years? J. TT and TD can of course be given lifelong. Okay? Alright. So now look over here. 13-month-old. Can you give measles? Yes. Can you give OPV? Yes. But I can't give penta. Can I give measles? Yes. Can I give OPV? Yes. But I can't give BCG. Okay. Can I give OPV first dose? Yes. DPT first dose? Yes. Measles first dose? Yes. BCG, penta, rota, I can only give till 1 year. So please don't get confused. This is the list. This is meant for your last minute revision. Okay. Delayed immunization. They can ask in your exams. Alright. All are correct about ILR. What is ILR, everybody? Ice-lined refrigerator. It is the most important equipment of cold chain. So can you mark these answers? Let's look at the first question. Keep all vaccines, including those returned under the open vial policy, in the basket supplied with ILR. Store diluents at, this is of course true. ILR mein you never dump the vaccines, you keep them in baskets that are provided. Store the diluents at +2 to +8 at least 72 hours before use. No. See, if you talk about a diluent, okay, listen carefully. Diluent you can store. Ideally, you should keep it in an ILR. But if you don't have space, you can store at room temperature. But 24 hours prior to session, 24 hours prior to session, it has to be brought at the same temperature as the vaccine. Otherwise, thermal shock होके toxic shock syndrome हो जाएगा. ठीक है? Keep freeze sensitive vaccine at the top. Now, what are the freeze sensitive vaccines? Who is going to tell me? Freeze sensitive vaccines क्या होते हैं? All the T series vaccines. They are the freeze sensitive vaccines. All right. T series vaccines are the freeze sensitive vaccines. And what is the, all right, what is the most freeze sensitive, everybody? What is the most freeze sensitive? Most freeze sensitive, guys, is hepatitis B. Hepatitis B. Arrange vaccines as per expiry date, of course. The ones that are going to expire soon, they should be taken out first. So this was the wrong answer. Now look over here. This is ILR. What is this? ILR. Okay? ILR is the most important equipment of cold chain. Okay, this one's the most important equipment of cold chain. Now I want you to know a couple of things over here. We open the ILR from the top, so all the cold air goes and settles at the bottom. So agar cold air bottom mein hai, at the bottom, which are the vaccines that we are keeping? Heat sensitive vaccines. And what were the heat sensitive vaccines? Who remembers the heat sensitive vaccines? Everybody, who remembers the heat sensitive vaccines? The mnemonic is R-bomb. RB से क्या हो गया? Reconstituted BCG. फिर क्या हो गया? OPV. फिर क्या हो गया? Measles. Reconstituted BCG we can use in 4 hours. So next one is what? OPV. OPV is at the bottommost. Hepatitis B is at the topmost. And at the center, everybody, हमारे पास होता है TTs या TT, the heart of ILR. ठीक है? Temperature monitoring of ILR is being done by a dial thermometer. I hope you remember. And dial thermometer की monitoring twice per day करते हैं. Medical officer does the monitoring. Okay, so you should know this. All right, a 9-month-old baby. Okay, what about vaccine carriers? I hope you remember, everyone, vaccine carriers. Okay, I will update you on the time, guys. So we have 1 hour more, I guess, for the session. Okay, we have 1 hour more for the session. Like, we're left with the smaller things now: environment, nutrition, disaster. Those are very easy topics, so we just have 1 more hour. That's why I think if you can sit down till 1 more hour, we will be wrapping up then. Okay, just to update everyone. Okay, all right. Now please remember, vaccine carrier कितने ice packs से lined है? 4 ice packs. Okay, and it can carry 16 to 20 vaccine vials. And what about day carrier, everybody? What about day carrier? Day carrier is lined by 2 ice packs and it can carry 6 to 8 vaccine vials. ठीक है? And one more question that you have, guys, इसको क्या बोलते हैं? I hope all of you know, this has 2 holes. This is an ice pack. You should know ice packs are meant for, the holes are meant for keep heat sensitive vaccines. Ice packs are prepared in a deep freezer. Okay, heat sensitive vaccines. Now coming back to the next question. A 9-month-old baby was brought for routine immunization. However, mother of the baby informed the doctor that the child is on tab prednisolone last 6 weeks. That means the child is immunocompromised. So which vaccine you will not give? No live vaccine. So all you have to do is figure out the live vaccine. Pentavalent is a combination vaccine. IPV is a killed vaccine. Pneumococcal is a subunit vaccine. What is the answer over here? MR vaccine. Now quick revision. I hope you all remember the mnemonic. I love chick embryo, guys. I hope you all remember. ठीक है, I से हो गया influenza, which is given by the nasal route. Love से हो गया live. चिक से हो गया चिकन पॉक्स में कौन सा स्ट्रेन था, ओका स्ट्रेन था. जेई, नाउ जेई वी हैव लाइव ऑल्सो एंड किल्ड ऑल्सो. ठीक है, इन द प्रोग्राम नाउ वी आर ट्राइंग टू गिव मोर ऑफ किल्ड वैक्सीन बिकॉज इंडिया हैज प्रिपेयर्ड इट्स ओन जेई वैक्सीन, द जीव. ओके, जीव is also like based on the strain SA14-14-2 only but in the killed form. M is what, measles or MR, BCG, R हो गया rotavirus, yellow fever as well as OPV. So remember that. ठीक है, so in immunocompromised states you are not going to give the live vaccines. But if somebody has little bit of fever, simple cough and cold, diarrhea, you don't have to contraindicate any infection, any vaccine. Okay. All right. What is the answer to this? 17-year-old traveled to Africa. He reported fever followed with chills. Which vaccine, if he had taken before travel, he could not have developed the disease? What is the strain? So we all know, now I'm marking it. 17D is yellow fever. Please remember, yellow fever vaccine live vaccine hota hai, and the validity of the vaccination certificate starts 10 days after vaccination. Validity starts of the certificate starts 10 days after vaccination. All right, and lasts lifelong. You should know that. And lasts what? Lasts lifelong. Okay, and you should also know that yellow fever, the vector is Aedes. Okay, and yellow fever doesn't occur in India. It's exotic for India, but anytime yellow fever can occur in India if the virus is introduced. Virus can get introduced via airports and seaports. So for that there is something known as Aedes aegypti index or house index, which has to be kept below 1% around 400 meters of airports and seaports, 400 meters of ports. This is a direct MCQ. ये दोनों question आ चुके हैं. ठीक है, Edmonston Zagreb guys, measles है, Geraldine we all know is mumps, Oka you all know is which one? Oka is chicken pox. ठीक है, chalo. So let's talk about, these are all your PYQ based questions guys. You don't have to worry at all. Last time also this question has turned up. Traveling उसमें लिखा इतना ही था, नाइजीरिया से अमेरिका जा रहा है. ठीक है, कौन सा वैक्सीनेशन सर्टिफिकेट लेना है. So please don't stress or strain your mind too much. All you need to do is master the topics. Okay, they will twist and turn with the language of the question or with the options, but if the topic is not clear to you, you will not be able to answer whatever be the language of the question. Okay, so don't worry too much, just keep revising and give in your best. Now tell me, what is the name of this IT based initiative? IT initiatives. I'm going to show you some IT initiatives. What is that? Monitors vaccine stock, distribution and cold chain logistics. It is EVEN app. Okay, electronic vaccine intelligence network. Everything where the vaccine is available, where is the stock, it is kept in this EVEN. It's a software. Tablet based application for A&M. What is it guys? Anmol. Monitors and follow reports adverse events following immunization. This is nothing but SafeVac. I'll show you the image also. Digital immunization registry to track immunization of 0 to 5-year-old guys. We use UVIN. Okay, UVIN this thing. And look at the last one. Mobile based voice messaging service by Government of India providing weekly audio messages. Like if any woman is pregnant, she can download an app which keeps sending her all the audio messages on what she should be doing. That is known as Skillkari app. That is known as Skillkari app. This could come in your exams. I have tried to give you the images also. You can go through this later. This is Anmol, this is SafeVac, this is UVIN, and this is EVEN. EVEN बताता है stocks of vaccines. ठीक है, one more thing guys that I wanted to ask you before I move to the next topic. What is the most, we didn't revise NIS. So let's quickly talk about NIS everybody. National Immunization Schedule. What are the vaccines that are given at birth? Be as quick as possible guys. What are the vaccines given at birth? So you all know it is BCG, OPV 0. Just keep repeating. Okay, I will write it. Hepatitis B. ठीक है. Then you have 6, 10 and you have 14 weeks. 6, 10 and 14 weeks. Remember the order also. This order is important. Now if I talk about 6, 10 and 14 weeks, we have the only live vaccines for which we require primary doses and booster doses. OPV1, OPV2, OPV3. Okay. Penta 1, Penta 2, Penta 3. Then rotavirus 1, rotavirus 2, rotavirus 3. Then we have PCV1, PCV pneumococcal conjugate. They are subunit vaccines. And also you have FIPV, fractional IPV1, fractional IPV2. Then 9 months. 9 months, what are we going to give? Measles, rubella first dose, JE first dose. ठीक है. For one booster, PCV booster we are going to give and fractional IPV ka third dose. You should remember. Along with this, vitamin A, preventive dose, 1 ml or 1 lakh international unit. Thereafter, guys, thereafter, every 6 months, till how many years? Till 5 years. What are we going to do? 2 ml or 2 lakh international unit. And we have discussed this before also. 9 doses and total of 17 lakh international unit. 16 to 24 months. क्या करना है? MR2, JE2 and the only live vaccine whose booster is required, OPV booster. Penta can be given till 1 year. So this is what? DPT ka first booster. 5 to 6 years everyone. What is it? DPT ka second booster. And then when are we going to give it? Then we are going to give it everybody 10 years and 16 years. So what is that? TD1 and TD2. Look over here. In NIS, it is tetanus diphtheria. But in trauma cases, it is going to be tetanus toxoid. Okay? So this is your NIS. Mission Indradhanush is going to protect from 12 diseases if you count over here. Okay. One more thing. Intersusception is the most common side effect of. Can anybody put in the comment section? Intersusception. किसका सबसे common side effect है? Intersusception is the most common side effect of. Please remember rotavirus. Yes, intersusception. Anybody who has history of abdominal surgery. Okay. Anybody who has history of abdominal surgery. Never, any child, never give rotavirus vaccine to that child. Okay. Going to the next one. Okay, one more thing we forgot. Pentavalent. Can you tell me the diseases in pentavalent? Diphtheria, pertussis, tetanus, hepatitis B and also Haemophilus influenza. ये भूलना नहीं. ठीक है. Hepatitis B is actually a recombinant vaccine which is prepared using hepatitis B surface antigen. Now our vaccines is complete. Now tell me the answer to this one. So here you just have to remember one equation, guys. This is a PYQ of FMGE exams only. Which factor has the greatest impact on positive predictive value? Remember, PPV is directly proportional to prevalence. NPV is indirectly proportional to prevalence. If prevalence of a disease increases, PPV increases. If prevalence decreases, then what happens? PPV decreases, NPV increases. And also one more word. Sensitivity, guys, and specificity of the test. Sensitivity and specificity of test are independent of prevalence. Okay? Are independent of disease prevalence. Whatever be the prevalence, it will not affect the sensitivity. अगर किसी टेस्ट की sensitivity 90% है, it's always going to remain the same. Clear? So this is straight away based on this particular equation. Alright, let's do a calculation and revise the sensitivity specificity formulas, guys. A screening test was carried out among 114 people, out of which 15 have a disease. The test showed 22 people tested positive for the disease, among which 14 actually had the disease. What is sensitivity? Rule number 1. सबसे पहले तो everybody give me a thumbs up. Are you still in the session? I hope you're not lost. We have some more time to go. Take a break of 1 minute. Just give me a thumbs up. And I hope you are enjoying the session. I hope you're not, like what we're trying to do here is we're trying to compile all the topics which have come in NEET and FMG and giving you. ठीक है? तो enjoy करना, keep smiling. I know exam is very near. It might feel too much of a pressure at this point of time, but trust me guys, it's just a phase. No one and nothing is more important than you as a person, for your parents, for your loved ones. So don't take it too much to heart. Abhi apna best do. This is something at this point of time, this is what is most important for you. All right, so keep smiling, keep revising, don't get too caught up in the FOMOs and all that. पॉजिटिविटी रखो, आगे बढ़ो, ठीक है. अब न्यूमेरिकल करो. डोंट गेट सैड बाय अ न्यूमेरिकल, डोंट पैनिक. फर्स्ट लुक एट इट दैट मैम ने क्या पूछा है. ठीक है, मैम ने क्या पूछा है. मैम ने पूछा है सेंसिटिविटी. सो ट्राई टू रिकलेक्ट द फॉर्मूला फॉर सेंसिटिविटी. ओके, ट्राई टू रिकलेक्ट द फॉर्मूला फॉर सेंसिटिविटी. नाउ इफ आई रिकलेक्ट द फॉर्मूला फॉर सेंसिटिविटी, इट इज एबिलिटी टू आइडेंटिफाई करेक्टली all those who have the disease. Okay, so TP upon, abhi before the session ends I will talk to you again about 2 minutes I will take again, all right, where I will tell you a couple of more things, the common mistakes that you can do when you're appearing for an entrance exam. Okay, I'll tell you. TP plus FN, ठीक है, मल्टीप्लाई 100. अभी देखो, आई एम नॉट राइटिंग एनीथिंग. ओके, जस्ट ट्राई टू सी विद मी. 114. सो ट्राई टू रिकलेक्ट व्हाट इज 114 गाइज. A plus B plus C plus D. Now I hope all of you remember A, B, C, D. I'll draw a table and show you also, but abhi I'm asking you, what is 15 guys? 15 is A plus B or is it A plus C? What is 15 everybody? Is it A plus B or is it A plus C? 15 have the disease. So is it A plus B or is it A plus C everybody? This is A plus C. Okay, and the test out of which 15 have a disease. The test showed 22 people tested positive. Now what is 22? Screening test positive, A plus B. So this 22 is A plus B, out of which 14 had the disease. This is A. ठीक है, अब आपको पता है A क्या होता है, TP. TP plus FN is what everybody? TP plus FN is A plus C. I'll draw the 2 by 2 table and show you. So this is 14 by 15 into 100, around 93%. Now let me draw the table. See everybody, यहाँ पे disease होता है. Okay, so disease, yes, no. And over here you have screening test result. This is what? Positive, negative. Now what is the order of ABCD? A, B, C, D. A क्या है? TP. B क्या है? FP. FN, TN. All right, following. Now 15 have a disease. So this is 15. 22 tested positive. This is 22. Out of which 14 had the disease. So this is your sensitivity. What is sensitivity? TP upon TP plus FN into 100. What is specificity? Ability to identify all those who do not have the disease. So how many do not have the disease? D plus B, or I could say TN plus FP, out of that TN into 100. Okay, and what is PPV? Out of all who have been tested positive, how many actually have the disease? So how many have been tested positive guys? TP plus FP. Out of them, how many have the disease? TP. What is NPV? Out of all those tested negative, how many have been tested negative? D plus C or TN plus FN. Out of them, TN. So एक चीज याद रखना, everywhere you have to multiply with 100, but remember negative में all negative predictive value, positives में you will have all positives. Clear? Did you understand this question? Please don't mess up in this exam. These values, these are very very important. These formulas ध्यान से करने की कोशिश करना, panic मत करना. Remember there are other questions also where you will only take 10 seconds. So पूरे पेपर में numericals नहीं है. 1 or 2 numericals you can spend a minute. but do it with a calm mind. Don't lose this 1 mark, guys. Trust me. Okay, chalo. Let's go to the next one. This is just for your quick revision. Quickly batao which point is the usual time of diagnosis. Anybody? Dream of break remains. Matlab? Adil? Acha. Dream of break. Oh, sorry. You wanted to break, yeah? I know. Okay, so in the following figure, what is the usual time? A क्या होता है? Disease onset. हाँ. B क्या होता है? B होता है first possible point of diagnosis. First possible point of diagnosis. Okay, first possible point of diagnosis. Now, what is this first possible point of diagnosis? Over here, there are no signs and symptoms. Remember, screening test is applied before signs and symptoms. What is X, guys? X is the critical point of diagnosis. If you want to get the advantage of a screening test, you should apply the screening test. This is the optimum time. And what is Y, everybody? Y is the usual point of diagnosis. What is the usual point of diagnosis? जब SNS है, signs and symptoms are there. So we would apply ideally at point Y, but now instead of applying at point Y, we are applying at point B. So Y is the usual point of detection. B to Y, guys, is the lead time. We are early in the detection of the disease by B to Y. B to X is the screening time. Guys, last NEET PG में they asked lead time bias. What is this? See, lead time bias, एक बार सुन लो, okay? It gives us a false sense of survival. Now, suppose somebody is having a lung cancer, okay? So, CT detected a lung cancer, okay? But chest x-ray will also detect a lung cancer. Now, when CT detected a lung cancer earlier than chest x-ray, it doesn't mean that so many years of lives are going to be added in a person's life. What happens is, it's just that by one modality, the disease has been detected earlier, but the person is going to survive till that duration only. Alright, so lead time bias is something which gives us a false sense of survival. A test is detecting the cancer earlier, but actually no years of life is actually being added. Okay, so you should know this concept of lead time bias. Chalo, what's the answer to this? Now we just have a couple of more questions to go. Death rate continues to decline and birth rate starts to decline. Reflects which phase of demography transition model? Highly and highly important. Batao. Death rate continues to decline. Birth rate starts to decline. Very good. This is stage 3. इसमें गलती acceptable है ही नहीं. What is first stage, guys? So I'll straight away take you to the image. This image is very, very important for your exam. Demography transition model. NEET PG gave to label. ये पहला वाला birth rate है and this one is death rate. What happens in stage 1? It is high stationary. What is high stationary, everybody? So it is governed by CBR and CDR. In high stationary, births also high, deaths also high. ऐसे 40 per thousand, 40 per thousand. Population stable. This is what? High stationary. The population is stable. What is the next thing? We always try to decline the death rates first, increase the life expectancy. Death rate क्या होता है? Starts to decline. Nobody is worried about birth rate right now. So what is it? It is still high. So what is this stage known as? ये इसको क्या बोलते हैं? Early expanding. Population is growing but at a tuck faster rate. It is also known as demography trap. No country wants to be in this stage. Then you have, this is early expanding. Then death rate क्या होता है? Continues to decline. Okay, continues to decline. And birth rate, what happens to it? Starts to decline. So this is what? Late expanding, as you can see over here. Birth rate for the first time declines in stage 3. Stage 4, again low stationary. What is low stationary, guys? CBR also low, CDR also low. and ultimately CBR is below CDR. So what is this, everyone? This is declining phase. So any of these phases could be asked in your exam. Suppose exam में आया highest birth rate, कौन से stage में, क्या बोलोगे? Highest birth rate, which stage? Everyone in the comment section, highest birth rate, which stage do you see highest birth rate, guys? So please remember, highest birth rate is always in stage 1. Birth rate remains the same in stage 2. ठीक है? Starts to decline for the first time, stage 3. And demographic gap होता है CBR minus CDR. Over here, the demographic gap is minimum. Over here, the demographic gap is minimum. Here, late stage 2, here it is maximum, the demographic gap. Here it starts contracting, okay? Starts contracting. And in the last stage, it is the demographic gap is negative. I hope you know when do we take the mid-year population. It is taken on 1st of July. So, a compilation of this entire thing, again you will find in the PDF about all the stages that I have written. As you can see, everything is written over here. India currently late expanding phase mein hai. Please remember that. European regions are in the declining phase. Okay, a couple of countries like UK and all, they are in the low stationary phase. Low stationary phase is one of the best phase. Year 1921 को बोला गया था year of great divide. Okay, क्योंकि 1921 के बाद population kept on increasing. Okay, chalo, now let's see this one. General fertility rate is, anybody, fertility indicators, what's your answer over here? General fertility rate. So let me straight away take you to the explanation. See, general fertility rate is what? Number of live birth, okay, in, what is your answer? अगर children बोला गया, children is what? TFR. We don't see unmarried women. Here it is number of live birth in a woman in reproductive age group. You can write 15 to 49 years also. That's completely fine. Nothing to worry about it. Okay. Now let me straight away take you to this slide. Everybody have a look over here. This is again your go-to slide. This is fertility indicators. You're going to expect a topic on this. Crude birth rate. Crude birth rate क्या होता है? Number of live birth per 1000 mid-year population. What is the problem in mid-year population? It has men also, children also, elderly also. Everybody cannot give birth. So we came up with general fertility rate. ये क्या होता है? Live birth per 1000. What are you going to write? Who can give birth? Women in reproductive age group. General fertility. But again, not every woman. An 18-year-old girl and a 20-year-old married female, 25-year-old married female. Who is more at exposed to giving birth? The married female. So what have we written? Marital fertility. इसमें क्या हो गया? Live birth per 1000. What are you going to write? Married woman in reproductive age group. So this is the order in which you're going to remember these three. Next one, total fertility. Total fertility rate क्या होता है? Total number of children. This is your buzzword. Total number of children. It is an indicator of complete family size. Family size only includes children, guys. Like mummy, papa, one son, one daughter. What is the family size? 2. It is only the number of children. Out of these children, how many are girls? That is gross reproduction rate. Out of them, how many remain alive? That means mortality dependent. Mortality dependent. That is net reproduction rate. These two, mortality dependent fertility indicator and indicator of complete family size, बहुत बार एग्जाम में आया. ठीक है. Couple protection rate क्या होता है? Indicates prevalence of contraceptive practice. For a country's population to stabilize, what is the desirable TFR? Anybody? Desirable TFR कितना है? For a country's population to stabilize, it is 2.1. India का current TFR is now not 2. It is India's current TFR. India current TFR is now 1.9 everybody. Okay, as per the latest SRS data. But desirable अगर किसी भी country का पूछा गया 2.1. It is 2-child norm. It is 2-child norm. And this means if there are 2 children, out of that 1 is girl. So for a country's population to stabilize, TFR कितना होना चाहिए? 2.1. This is possible when NRR is one girl child only, and this is possible when at least more than 60% couples are using a contraceptive method. In India, almost 66% couples use a contraceptive method. Okay? So look at me once. What are the questions you will remember from here? Complete family size indicator, TFR. Mortality dependent fertility indicator, NRR. Okay, for a country's population to stabilize, what should be the desirable TFR, everybody? 2.1. That means NRR 1. One woman will replace herself with one girl child. And what should be the couple protection rate or contraceptive prevalence rate? More than 60%. Okay? Okay. Now tell me answer to this one. A woman underwent an IUD insertion in a PHC. What is she most likely to report in the future? So most common complication, most common side effect of IUD insertion, everybody, we all know is bleeding. What is it that we have to do? Reassure. You can put her, you can also give her some mefenamic acid, NSAIDs and all that, but you can put her on iron tablets also. And what is pain, guys? What is pain? Pain is the most common cause of removal. Most common cause of removal. Most common cause of removal, everybody, is pain. Okay, next one. Now look at these IUDs. Which two are provided freely till the level of subcenter? Ye wala and ye wala. ठीक है, ये वाला and ये वाला. This one is copper T 380A. It has a white thread. It is completely straight, everybody. Shelf life is 10 years. This one you can let it be. Novati copper T 380AG है ये actually. These are, A stands for arms. This is 380 millimeter square of copper wire is wound around it. Okay, is my voice coming? Everybody? 380AG. Am I audible, everyone? Okay. And this one over here, this is multi-load. Multi-load में blue thread है. And what is this one? This one is copper T 375. This one and this one you can get till the level of subcenter. Freely provided till the level of subcenter. This one is Mirena, guys. LNG 20. This is what? Mirena. LNG 20. इसका shelf life अब 5 to 7 years है. See, we can use it up to 7 years. This one, Mirena, although this is LNG 20, it releases so much hormonal containing. These are all second generation. Copper containing is second generation. Mirena has the least failure rate out of all. ठीक है? Contraceptive option available to a 28-year-old breastfeeding mother with 6 weeks old baby wishing to avoid next pregnancy are the following except. So what is the contraception of choice, everyone? If we like first 6 weeks of delivery, please remember ध्यान से पढ़ो. It is asking except which one you will not advise within first 6 weeks of delivery. So contraception of choice within 6 weeks of delivery, within 6 weeks of delivery is which one? It is no longer IUDs. It is progesterone only pill. Okay, within first 6 weeks of deliveries. IUDs we can insert up to 48 hours post delivery, up to 48 hours post delivery और after 6 weeks. ये याद रखना, ठीक है? OCP is not advised for 6 months. It is not advised for 6 months. So here your answer is OCP. Rest you can. ठीक है? But except यहाँ पे क्या है? Not advised for the first 6 months. Which one you are not going to advise? OCP. Clear? So you should remember the timings of copper T's insertion. That is important. OCP can be advised safely to a woman in which of the following conditions? So, okay. चलो इसका आंसर दो everybody. OCP can be advised safely to a woman in which of the following conditions? वेरी गुड. ब्रेस्ट कैंसर का तो रिस्क बढ़ाता है. ब्रेस्ट कैंसर, सर्वाइकल कैंसर, हाइपरलिपिडीमिया ड्यू टू OCPs, you cannot, estrogen, progesterone, liver disease, no, those are absolute contraindications. PID में what is contraindicated? IUCD is contraindicated in PID, but यहाँ पे दे सकते हो. So you know this is a very very important table. This is a very important slide of the day. Look over here. Absolute contraindications of OCP when you will not at all give OCP. Breast and genital, basically cervical cancer. ठीक है? Cardiac abnormalities. Then congenital hyperlipidemia, undiagnosed uterine bleeding, liver and thromboembolism. You will not advise. Estrogen बहुत dangerous है, heart में problems कराता है. But look at this, indications of OCP. ये पढ़ के जाना guys. This could come as options. This is according to WHO. Indications of OCP, ठीक है, where we can give up to 40 years. Beyond 40 years तो नहीं देना है, ठीक है, but if she is smoker then up to 35 भी नहीं देना है. Post abortion दे सकते हैं, anemia दे सकते हैं, GTN दे सकते हैं. Ectopic pregnancy you can advise, endometriosis, dysmenorrhea, PID, epilepsy, thyroid disease, varicose vein, TB, HIV. देखो, in HIV you can advise OCP, but you will also have to ask them to use a barrier method. Very very important table for the day. Okay, can I go to the next one? Now this one we have revised before also. This is Mala N and Mala D, guys. Mala N is provided freely. This is provided freely, and this one that we know is provided under the social marketing scheme. Provided under the social marketing scheme. So this you should know. Revise the amount of estrogen as well as the amount of progesterone. Now quickly answer this one. Identify the contraceptive. ये क्या है? There is a V-shaped band over here. So what is this contraception? Can you tell me in the comment section what is this type of contraception? This is a barrier method. और ये क्या है? Diaphragm? नहीं, this is not a diaphragm. Diaphragm cervical cap होता है. ये vaginal sponge है. V-shaped band. Today it contains the chemical non-oxynol 9. Okay, almost 1000 milligram. That is a spermicide. It has to be inserted 2 to 6 hours prior to sexual intercourse, kept up to 6 hours post delivery, otherwise it leads to toxic shock syndrome. Other than this, everybody, you must remember that it does not protect from HIV STDs. ठीक है? Similar to this, everything is diaphragm, but diaphragm has a lower failure rate. Okay, and a woman has to leave vaginal sponge and diaphragm up to 6 hours post ejaculation. If she forgets to take it out, it can lead to toxic shock syndrome. ठीक है? By 24 hours अगर वो भूल गए. What is the answer to this? Absolute contraindication for IUD are all except. So where can you actually get a copper T inserted? Of course, pregnancy में कभी नहीं, vaginal bleeding नहीं, PID, current history of PID तो है ही नहीं, uterine malformation में IUD insert किया जा सकता है. और यहाँ पे देख लो contraindications, absolute and relative. You have to revise. Previous ectopic pregnancy is a relative contraindication. The person has to be careful. Unmotivated person, because they have to feel for the thread, guys. Okay, so these things you should remember. PID, see, most complications arise when we are actually inserting the device. Okay, so we have to be very careful. Actinomyces is something which could really cause a lot of trouble. Okay, actinomyces organism is very very responsible. Okay, one more thing, guys. MTP Act. According to MTP Act, in case of contraception failure, MTP कब तक allowed है बताओ? In case of contraception failure, MTP is allowed up to how many weeks? Quickly in the comment section. 20 weeks. Very good. One doctor. 20 to 24 weeks, 2 doctor होता है. But beyond 24 weeks, if it's endangering the life of the mother, in that case, it is a medical review board. Okay. Do revise MTP Act from your forensic and go for your exams. Alright. And I hope you remember that vasectomy में कितने ejaculations the person has to be free post vasectomy. Use barrier method up to how many months? Barrier method कब तक यूज करना है? up to 2 months और up to 3 months. और कितने ejaculations free? 20 ejaculations free. And to get a vasectomy or a tubectomy, to be eligible for that, the couple should have at least, the person should have at least one child more than 1 year of age. ठीक है? Okay. Now quickly give me the answer to this. A study was, we have another half an hour on the clock. That's it. So answer do iska. A study was conducted among nursing staff to find out the time taken in different aspects of patient care. Bed preparation, monitoring of diagnosis, all of this. Which management technique would it be applied for the analysis? So what is this, guys? Work sampling. Okay. Work sampling. This has come 2 to 3 times. So I thought I will revise with you this. It is just observing the patients, observing the health professionals, how they are carrying out their roles and responsibilities. Okay? These are all the qualitative management techniques, quantitative management techniques. These name you should know. And for the qualitative techniques, also I will tell you the name. Qualitative techniques are based on behavioral sciences. What was the mnemonic for the qualitative techniques? Can anyone in the class tell me if you have seen the RRs also? It is nothing but Pokemon. So P stands for personal management. Personal management. Okay, personal management. O stands for organizational design. O stands for organizational design. C stands for communication. C stands for communication. I stands for information system. Okay, information system. And what is MON, guys? MON is nothing but management by objectives. Management by objectives. तो एक तो simple question यही आ जाता है, which is the management technique based on behavioral sciences and which is the other one. So you should remember this Pokemon. ठीक है? इसमें कॉस्ट बेनिफिट और इफेक्टिव एनालिसिस को पढ़ लेना गाइज में. गाइज एग्जाम में दैट कम्स कॉस्ट इफेक्टिव इज नॉन मॉनेटरी टर्म्स. ओके, सो आई एम जस्ट क्विकली रिवाइजिंग. इट इज असेस्ड इन द नॉन मॉनेटरी टर्म्स. Cost benefit, we look at the outcome in the monetary terms. All these things that I've given you in the form of table and PDF has to be done. Critical path method is the longest path. Okay, it is the longest path. Chalo, next one, SDG, quickly. Which of the following statement is not true according to Sustainable Development Goal? Who's going to answer this? End the epidemic of AIDS, TB, malaria, combat hepatitis, reduce global maternal mortality ratio to less than 70. ये बहुत बार PYQ आ चुका है. Reduce neonatal mortality rate to as low as 20. Reduce under 5 mortality to as low as 25. Under 5 25 है, but NMR कितना है guys? 12. Okay, NMR is 12. One more line you will remember. Reduce premature mortality due to NCDs by what percent? Reduce premature mortality due to NCDs. इसमें ये भी याद रखना, by 33%. ठीक है? And SDGs have been given by United Nations. United Nations are the ones that framed SDGs. These value things you should know. This is the logo of United Nations. Okay, it has 17 goals. That's okay. Third goal is what we are focused on, and the values for your last minute revision. Okay, now let's come to the last couple of things. Environment, nutrition, disaster. Okay, true about sewage. Now what is sewage, everybody? What is sewage? Sewage क्या होता है guys? Sewage होता है liquid waste with excreta. It is nothing but liquid waste with excreta, guys. So tell me the first statement. Does not contain human excreta? Absolutely wrong. Heart of activated sludge process is aeration tank. Now in the sewage treatment, guys, aeration tank is used for secondary treatment of sewage. What is it used for? Secondary treatment of sewage. Okay, and we prefer activated sludge process because it takes very less, it occupies less space. BOD is biological oxygen demand. It is the most common test done on sewage. It is a strong sewage? No. BOD of how much? More than 300. Normal strength sewage is 100 to 300 BOD. ठीक है, have you given the answers? Very good. Composed 90% water, बिल्कुल गलत. 99.9% water plus 0.1% solids. Dry weather flow, this is again a PYQ. It is the amount of sewage that flows through sewage pipelines in 24-hour period. So this is also true. So what is the answer over here? B and E are true. Strength of sewage you can also measure in terms of suspended particle count, guys. In terms of suspended particle count, please remember 100 to 500 अगर है, this is normal strength. But if it is more than 500, then it is strong sewage. ठीक है, ये question exam के लिए important है. BOD is the most important test which is done on sewage. All are methods of solid waste disposal except. So what are the which is not a method of solid waste? Solid waste means we are talking about what? We are talking about refuse. So can you tell me which is not a method? Very good. Oxidation pond नहीं होता है. Oxidation pond is for sewage. अभी oxidation pond पे भी question आएगा. See over here, incineration is like burning. We don't really prefer in India. Compositing, ये याद रखना, mnemonic, CBI. B stands for Bangalore method and I stands for Indore method. इसमें AN is what? Anaerobic process and Indore is what? Aerobic. Then you have sanitary landfill. इसमें एक method पूछते हैं or control tipping, which you have to remember the trench method in which we dig a trench. और कितना deep trench dig करना होता है everybody? For a population of 10,000 a 2 meter deep trench dig करते हैं. और कितना, like what is the land which is needed? This is a PYQ. 1 acre land, okay, per year is required. Therefore it's very costly, okay, it's very costly, but it's the best. Most commonly जो हम लोग method करते हैं, that is the area method, okay. Area is most commonly done. Since incineration we don't prefer. If I live in a rural area, which is the method we prefer? Manure pits, okay. In our backyard we are going to dig 2 pits. And if I have gone camping, which is the method I will use to dispose of the solid waste? Burial. ठीक है, रिविजन डन. गिव मी अ थम्स अप, गिव मी अ थम्स अप. सॉलिड वेस्ट डिस्पोजल का रिविजन हो गया. अब सीवेज का ट्रीटमेंट देखते हैं. ऑक्सीडेशन पॉन्ड. हु रिमेंबर्स ऑक्सीडेशन पॉन्ड? एवरीबॉडी. Great. Some more minutes, guys, on the clock, okay? Oxidation pond. Now see, follow what I'm writing, okay? Don't be in a rush. देखो, primary treatment, you have to know sewage disposal, okay? Something which is very ignored by the students, sewage disposal. Primary treatment, you have SGS. What is S, guys? Screening. What is G? Grit chamber, okay? Grit chamber. And what is S again? Sedimentation tank. Sedimentation tank. Now the question that comes, what is the process we use in sedimentation tank? It is anaerobic, okay? It is anaerobic. Then secondary treatment. For secondary treatment, we have 2 things. Trickling filter, we can use a trickling filter. We can also use, everybody, activated sludge process. Activated sludge process. ये क्या use करता है? This uses aeration tank. This is the one we prefer. Both secondary treatment में we rely on which process? Aerobic process. Other methods, if you talk about other methods, in other methods we have oxidation pond. What do we have? Oxidation pond. Or you could also call it as lagoons, or you could also call it as ditches. चलेगा. तो इसमें क्या होता है ना, ऐसे बनाते हैं हम लोग एक आर्टिफिशियल पॉन्ड. इट हैज अ लोअर लेवल, इट हैज अ अपर जोन. इन द लोअर लेवल इट इज विच प्रोसेस? एनारोबिक. इन द अपर जोन इट इज विच प्रोसेस? एरोबिक. हियर यू हैव द सन. All right. Now during daytime, the question asked during day, what is it? Aerobic during day and anaerobic during the night. During daytime, aerobic is more than anaerobic, okay? And during night, which process is more? During night, anaerobic is more than aerobic. Remember this. But lower levels में हमेशा anaerobic है, upper के levels में aerobic है. Done. Primary treatment anaerobic है. Secondary treatment, it's an aerobic process. And of course, you should know about oxidation pond. चलो. Next question, what is the requirement of amount of bleaching powder required to disinfect 455 liters of water if third, fourth and fifth cup of Horrocks apparatus show distinct blue color? I only want to revise a formula over here. Horrocks apparatus क्या measure करता है? Chlorine demand. Okay, Horrocks apparatus measures what? Chlorine demand. Amount of chlorine which is needed to disinfect water. N into 2 grams bleaching powder will disinfect what? Will disinfect 455 liters of water. And what is N, guys? What is N? N is nothing but the first cup. First cup to shows color change. First cup to show color change. अब यहाँ पे पहला cup कौन है? N is equal to 3. So what will it be? 3 into 2, which will be 6 grams. Okay. I just wanted to revise this 455. ये मत भूल जाना. N into 2 grams. And N is the first cup which shows color change. Clear? Alright, let's do another question. All of the following statements are true about breakpoint chlorination. What is breakpoint chlorination? Breakpoint chlorination is the point at which chlorine demand is met. Okay, is met. That means suppose ये पानी, suppose मेरे पास 1 liter पानी है, okay? Now to treat this, I need how much of chlorine? And chlorine is most commonly used in the form of bleaching powder. So when I calculate that, it is breakpoint chlorination, which a Horrocks apparatus will help me calculate. Okay? And after I have calculated the free chlorine demand, I will add some extra chlorine so that water remains disinfected. This extra chlorine that I add, guys, is known as free chlorine. So free chlorine is released in water after breakpoint? Yes. Free chlorine क्या करेगा? It will keep the water safe. It will keep the water treated. So it is released after breakpoint chlorination. Chlorine demand is the amount needed to kill bacteria, virus, spores. It cannot kill all the spores, everybody. It cannot kill all the spores. It can only kill bacteria, okay? It does not kill all ova, all cyst and all spores. इसीलिए definition गलत हो गया. Free chlorine का level 0.5 ppm in drinking water for a contact period of 1 hour, that we know. Post disaster 0.7, swimming pool 1. ठीक है, that we know. Hypochlorous acid mainly responsible, yes, HOCl. This is 90% responsible for disinfecting. And what is the other one? OCl minus. ये कितना है? 10%. So pay very good attention to the wordings, guys. Breakpoint chlorination होता है when chlorine demand is met. How much chlorine is needed to disinfect? That is chlorine demand. Once we calculate that, free chlorine is released into the water. Okay. One more question. Look at a question on OT and OTA test. Now, what was OT and OTA test? So, we'll read each of the options. Okay. OT and OTA test were used to measure free chlorine. ठीक है, free chlorine. अब पहला option देखो. OT test can detect both free and combined chlorine separately, making it superior to OTA test. No. Which is superior? OTA test is superior because it can detect free as well as combined chlorine separately. Breakpoint chlorination is achieved when chlorine demand is exceeded. अभी discussed किया. Chlorine demand is met, after which free chlorine is released. OTA test is unable to detect combined chlorine separately and is affected. No. OTA test तो करता ही है. What is the best answer here? OT test can detect free chlorine separately but not combined chlorine separately. But OTA can detect both free and combined chlorine separately and it is also not affected by interfering substances. ठीक है? अगर कोई आपसे पूछे, can OT test detect combined chlorine? Can it detect combined chlorine? Yes, but not separately. Okay, but not separately. कैसे करता है? Total minus free. Okay, and when you add these reagents, guys, you have to look at the yellow color first 10 to 15 seconds. Yellow color within first 10 to 15 seconds is due to free chlorine. Otherwise, it is due to both free as well as combined chlorine. Very important. ये last two MCQs बहुत important है. चलो इसका आंसर दो. PYQ है. It came as a question not within acceptable limits for safe drinking water. Now I have told you in the in the afternoon फ्लोरीन का लेवल 0.5 to 0.8 एक्सेप्टेबल है. व्हाट इज द लेवल ऑफ नाइट्रेट? इट शुड बी बिलो 50 मिलीग्राम पर लीटर. अगर पानी में नाइट्रेट आया, इट इंडिकेट्स रिमोट कॉन्टैमिनेशन ऑफ वाटर, कैन लीड टू मेथिमोग्लोबिनीमिया. ओके, रिमोट कॉन्टैमिनेशन. TDS 300, ये तो बहुत अच्छा है. TDS जो मैक्सिमम, देखो स्टैंडर्ड प्रेस्क्राइब्ड, TDS standard prescribed everybody is like 600, okay, but max permissible level, max level for TDS can go up to 1000. कैडमियम नॉट मिलीग्राम, माइक्रोग्राम. ओके, कैडमियम फर्टिलाइजर्स और ये सब में होता है, इट कैन डैमेज वाटर. वन मोर थिंग गाइस, क्लोराइड्स. इफ आई टॉक अबाउट क्लोराइड्स, स्टैंडर्ड प्रिस्क्राइब्ड इज 200, बट मैक्स लेवल दैट इट कैन गो इज अप टू 600. ठीक है. पानी का pH कितना एडवाइजेबल है? 6.5 to 8.5, बट क्लोरीन बेस्ट कब काम करता है एवरीबडी? pH 7. ओके, हार्डनेस ऑफ सॉफ्टनिंग ऑफ वाटर इज रिकमेंडेड एट सॉफ्टनिंग. पानी को सॉफ्टन कब करोगे? जब लेवल ऑफ हार्डनेस इज एटलीस्ट 150. ठीक है, दैट यू शुड रिमेंबर. एंड मोस्ट अनडिजायरेबल मेटल इन वाटर इज लेड. मोस्ट अनडिजायरेबल, सबसे अनडिजायरेबल होता है lead. So this you should know. All right, now quickly, what does the following instrument measure? What is this, guys? What is the name of this instrument? So this one is sling psychrometer. You can get these images. It measures what? Air humidity. Very good. Now I'm going to go a little fast, okay? This one, sling psychrometer, measures air humidity. What is this? Red रंग का very thin bulb. Okay, this one, everyone, is a Kata thermometer which measures low air velocity. More importantly, it can also measure cooling power of air, but you have to select one as the option. You will go for low air velocity. This image you can't see everybody, but like I have just scrolled it, this is a globe thermometer. Okay, it's like a globe over here. This is a globe thermometer. This measures what? Corrected effective temperature or the radiant heat. Don't get confused. लाल रंग का बल्ब is काटा. ठीक है, ग्लोब की तरह दिखने वाला is a globe thermometer. Then these are all your instruments. They have come in the exam, guys. This one is hygrometer. This one is asked in the exam. This one is dry and wet bulb hygrometer. सबसे common use होता है dry and wet bulb hygrometer. Then if you look at these two, these are your sling psychrometer. Okay, sling psychrometer. And if you look at this one, everybody, this is your Assman psychrometer. Okay, Assman psychrometer. You should know these images can come in your exams. Okay, now let's go to occupational health. Give me the answer to this. Medical officer examines workers in sandstone industry, diagnose silicosis. Silicosis and asbestosis has to be answered. What should be his comments? It is reversible once the cause is removed? No. Reversible नहीं होता है occupational cancers. Okay, whatever changes have occurred cannot be reversed. It takes 6 to 10 years to develop. Okay, it can take more than that also. That's okay. Fibrotic changes in the lung of the patients can be reversed. नहीं. TB स्क्रीनिंग, yes. सिलिकोसिस क्या लेके आता है? सिलिकोट्यूबरकुलोसिस. सिलिकोसिस में यू कैन ऑल्सो सी दिस इन सीमेंट इंडस्ट्री, गाइज. वेरी वेरी इंपॉर्टेंट. सीमेंट इंडस्ट्री में सिलिकोसिस होने का चांस बहुत होता है. सैंडस्टोन इंडस्ट्री, दैट इज इम्पॉर्टेंट. और स्नो स्टॉर्म अपीयरेंस होता है. एंड सिलिकोसिस ऑलवेज affects the upper part. ठीक है, upper part of the lung fields. Now this is a very important thing in the PDF. All points about silicosis. TB के लिए risk factor है. Most common pneumoconiosis, most common cause of death, most common cause of disability. So you can go through this. Nodular fibrosis. Asbestosis, most dangerous is the amphibole variety. ठीक है, this presents with most specific mesothelioma. Adenocarcinoma is most common. Ground glass, this thing. कोसिस कोल माइनर्स में देखा जाता है, ब्लैक लंग देखने को मिलता है एंथ्राकोसिस में, बिसिनोसिस कॉटन डस्ट एंड दिस वन, बैगोसोसिस में कार्डबोर्ड इंडस्ट्री पता होना है, शुगर केन वेस्ट, इट इज नॉट नोटिफाइबल एंड इट ऑल्सो प्रेजेंट्स mottling of lung fields. Okay, it presents mottling of lung field and we need to spray with 2% propionic acid. Farmer's lung is micropolyspora fini, so do go through this. Okay, quickly mark this answer guys, we're a little short of time. फटाफट से बताओ, bagosausis क्या हो गया, sugar cane dust, bicinnosis क्या हो गया, cotton, farmer's lung grain dust or moldy hay, woodworker's lung is pine dust or oak cedar. ठीक है, so you can do this match of the following yourself and see which one comes to the answer. A आया, ठीक है. Okay, a factory worker sustained burns involving 25% of his body while on duty. He later developed infections and related complications. Under ESI Act, which benefit is he entitled to? So, which benefit is he entitled to, guys, under ESI Act? Can anyone tell me? Is it sickness? Is it dependent? Is it extended sickness? Is it disability? So, let me show you something, okay? Let me show you something. सबसे पहले तो ये medical benefit नहीं है, okay? Not medical benefit. Please remember, medical benefit is always full medical care. Okay, it is full medical care. You can get it direct, you can get it indirect, and it is a cashless benefit. Direct is via ESI hospital, indirect is empaneled. अब यहाँ पे देखो, sickness benefit 70% wages for 91 days. ठीक है, this is extended sickness benefit, 80% wages for 2 years. Look at the diseases: TB, leprosy, HIV, malignancies, plagias, empyemas. More than 20% of burns with infections and complications, they fall under extended benefit. Okay, these list of diseases. पहले हमेशा they used to give TB, guys. Last time they changed it. Okay, so you should know this. Enhanced sickness benefit is vasectomy, tubectomy, that you already know. Maternity, full wages. It can be availed 8 weeks prior also. Temporary disablement, permanent, that's okay. Funeral expenses is how much rupees? 15,000. Clear? So these benefits you should know. So over here the answer is extended sickness benefit. Okay, recommended dose of iodine for lactating women according to NIN, guys. So I'm just going to straight away tick the answer here. फटाफट से answer बताओ. Lactation में what is the iodine requirement, everybody? It is nothing but 280 microgram per day. So this is a chart which you can go through in your free time. आयोडीन बढ़ जाता है during lactation, आयोडीन का requirement बढ़ जाता है. Then you should also know calcium requirement increases during lactation, and of course you should know vitamin A. Pregnancy के time it is iron, this is 27, okay, iron and folic acid that increases. ठीक है, so you should know these requirements and these supplements. ये dose आयोडीन का exam में आया था, that is why I have checked up. Okay, food adulteration. What is the answer to this? A 45-year-old man, a 45-year-old man presented with a 45-year-old man presented progressive muscle weakness and leg spasm for 2 months. He said he has been consuming a dal resembling red gram. सबको पता है, this is a case of neurolethyrism. Wanted to discuss this topic. All right, it's an example of food adulteration, everybody. तो इसमें कौन सा ये देना है? Which of the following can prevent it? Vitamin C. Next one, a man presents with sudden onset bilateral leg edema, leg swelling, diarrhea, difficulty breathing, reports consumption of mustard oil purchased from a local vendor. Health inspector इसको investigate करेगा. So what is this, guys? This is epidemic dropsy, not C. Epidemic dropsy, contamination of mustard oil with argemone oil. What is the test that you will do? Paper chromatography. These are for pasteurization. Okay, these are for pasteurization. Nitric acid raw है. Paper chromatography, everybody, is more sensitive. Okay, it can detect even detect even very less amount of contamination. So again, this slide you should go through for your exams. All the food adulteration I have written over here. Kesri dal, न्यूरोलथायरिज्म, एपिडेमिक ड्रॉपसी, नॉन-इन्फ्लेमेटरी एडिमा इज द बज़वर्ड, मिलेट्स को कंटामिनेट झुनझुनिया सीड्स कर सकता है, एफ्लाटॉक्सिकोसिस हैज ऑलरेडी कम इन द एग्जाम, एंड लास्ट टाइम ग्राउंड नट को जो इन्फेस्टेशन होता है, एंड लास्ट टाइम द थिंग दैट केम वाज बाजरा. बाजरा गेट्स इन्फेस्टेड विथ व्हाट एवरीबडी? बाजरा गेट्स इन्फेस्टेड with claviceps fusiformis leading to ergotism. Please don't forget to revise food adulteration. Okay. All right. Last thing from nutrition. Rahul आया है 35 year old, अपनी मम्मा को 70 years old. The family doctor is advising Rahul and his mother on adequate nutritional requirements. Rahul tells the doctor weight is 65 kg, is a teacher. Yeah, is a teacher. And his mother stays at home. So basically इसकी मम्मी क्या है? Elderly है. So for elderly female, what is the calorie, guys? 1500 kilocalorie. But Rahul is a teacher. So Rahul is a sedentary worker. And for sedentary worker male, what is the amount of kilocalories? What is the amount that we give? 2110. So some of you got it correct. Only a couple of people got it correct. So energy guidelines को revise कर लो मेरे साथ, guys. Adult man and woman, sedentary, moderate, heavy, 2110 को 2100 कर लो, 2700 कर लो. Same is required by a moderate heavy worker female. You can do this 2100, you can do this 2700. If you don't remember it exactly, 1660 you can do it 1700, this becomes 3400. Pregnancy plus 350 average in all trimesters, okay. Lactation plus 600 and plus 520 in the next 6 months of lactation. ठीक है? Alright, this is reference man and woman criteria. Read it definitely before exams. Reference man and woman, what I want to tell you is this one, 19 to 39, 65 kg. So you should go through the criteria for reference man as well as reference woman. Alright, what is the answer to this? A hypertensive patient is advised a diet plan which advises salt restriction. How much reduction in systolic blood pressure is expected by this intervention? So what are you going to answer over here? So for that, everyone, okay, so what is the answer over here? Look over here. So here I had asked you about salt restriction. Okay, so you have to follow this chart because again this is given in our textbook of PARC. Salt restriction करने से systolic blood pressure कितना कम होता है? 2 to 8 mmHg. So this is just a chart, guys. इसको एक बार नजर मार लेना. Most important over here that you could get is salt restriction, which I have given you. Physical activity 4 to 9 mmHg. Weight reduction for every 10 kg weight loss 5 to 20 mmHg. ठीक है? So go through this chart. Alright, last but not the least, patient presented with loose stools and skin rashes over sun-exposed area. Dietary history revealed that the patient has been consuming a jawar-rich diet since childhood. The condition results due to excessive of which amino acid? So what is the answer over here? To this question, everybody, why did the condition result? It is excess of leucine. So among jawar eaters, among maize eaters, you all know there is niacin deficiency. So it is because of excess of leucine in the diet. Okay, now let's see if you could do this calculation, guys. What is the question over here? So the question is, a city has 70 lakh urban population. Okay? This is a NEET PG PYQ. 30% of whom reside in slums. How many urban PHCs are required for slum population according to NUHM? अब इसको कैसे करोगे, guys? So please remember, one urban PHC, okay? One urban PHC is for 50,000 population. Now all you need to see is there is so much of population. 30% reside in slums, okay? So 30%, 30 by 100 into 70,000, okay, into 70 lakh. You will do it. All right, so you have to just do a okay, take your time, just try it everybody and tell me what does your answer come to. I'll give you 1 minute, no rush. Isko ek baar kar lo. Let's see what is your answer over here if you calculate. Kitna answer aata hai tumhara? Anybody with the answer? Anybody with the answer? A. Very good. So you have to see how much this population amounts to. So how much does this population amount to, everybody? 30% of 70 lakh population kitna ho jayega? Around this much. Okay. Now we know for 50,000 population. Okay. So you can just do it. So for 50,000 population, we have one PHC. So we will have to look for this population, how many we are going to have, and if you check it out, your answer will come to 21. Yes, if you check it out, your answer is going to come to 42. Okay? So you just have to use the concept ki one PHC is for 50,000 population. So for this much it is how much? Okay, now tell me the answer to this. Male multi-purpose worker, where is he posted? He is posted in a sub-center. So maintenance of eligible couple register, also known as family planning register. Whose responsible is this? Whose responsibility is this? Multi-purpose worker, female or ANM. What are his functions? Collect sputum sample, malaria surveillance, distribution of ORS. Okay? This is active malaria surveillance. Perform hemoglobin and urine testing. This is a function of ANM, guys. Okay? Now you should know ANM, male multi-purpose worker and female, they have to be 12th pass and they also have to have a training of 12 months. But I hope you all remember Asha. Asha ka training age kitna tha? 25 to 45 years of age. She receives 23 days training. 1 per 1,000 population pe hai. She can be married, divorced, separated, widowed. Alright. And she is selected by the village panchayat. She is an example of community participation. PDF will be shared after the class, guys. Please don't worry. Okay? Yeah, and very important, she has to be 10th pass. Good. Next one, post-earthquake, some buildings were destroyed and building codes were changed to make more earthquake-resistant building. What is this known as? So, you are taking steps before disaster. You have to prevent the hazard from becoming a disaster. So, iska answer kya hai, everybody? The answer over here is mitigation. Steps taken prior to disaster. Okay, and this we use engineering modalities. What is the answer to this one? In a sudden onset disaster, recovery phase consists of which of the following? Recovery phase. So please remember, recovery phase only has response and rehabilitation. Preparedness and mitigation nahi hota hai, theek hai? Preparedness and mitigation, this is prior to disaster. This is recovery phase. I hope all of you know the triage. Triage is done according to the likelihood of survival, guys. Red ko yaad rakhna, you can call it as highest or high. Okay, first 6 hours, it needs priority, first 6 hours. Then like hemothorax, pneumothorax, limb saving surgery, this is yellow or blue. Yellow or blue kya hota hai? Medium priority, 6 to 24 hours. Then you have the green color. What is green, everybody? Green is the ambulatory, low priority. Okay, low priority. And finally you have the black. Black is the dead or moribund. This is which priority? Least priority. Reverse triage war settings mein hota hai, that we have discussed before also. Reverse triage. Reverse triage is in war settings. And yes, what is the Ministry for Disaster? Ministry of Home Affairs. ठीक है? Ministry of Home Affairs. All vaccines contraindicated post-disaster. Post-disaster, you are only going to give measles vaccine. ठीक है? Measles vaccine. That too only to children within 3 days of exposure. But for workers who are working in a disaster endemic zone, give all vaccines except measles. Okay, what is the answer to this one? A hand washing awareness session was conducted in a community. The correct sequence of events here is. So I hope you remember there is a sender who frames a message via a message. It goes via a proper channel to the audience. Audience से हम लोग feedback लेते हैं, but the audience accepts it in the form of a ITA model. What is it? Awareness. Awareness should generate interest. Then the person will evaluate it, and then he will say, give a trial, and finally he is going to adopt it. This is the ITA model, and this ITA is also a part of, guys, this is also a part of the motivation model. पहले evaluation last में नहीं है. Please remember this ITA: awareness, interest, evaluation, trial and adoption. इसमें गड़बड़ नहीं करना है, ठीक है? Okay, next one. Which out of the following health information collecting system provides data on registration of birth, death, infant mortality, abortion, pregnancies, marriage and contraception use? क्या आंसर दोगे इसमें? Census मत बोलना. Census is only like, you know, literacy rate हो गया, population dynamics हो गया, all of that. SRS only gives us info, not SRS, and SRS doesn't tell you about marriage and contraception use. No, SRS tells us about current CBR, it tells us about CDR, it also tells us IMR, it also tells us MMR, it also tells us the growth rate, nothing else, guys. Civil registration system, birth and death registration, which has to be done within 21 days. The answer to this is NFHS. NFHS is conducted by International Institute of Population Sciences, जिसका headquarter कहाँ है? Mumbai. SRS, guys, is a dual recorder system. Okay, it is the most dual recorder system. It is the most efficient system. ये question आया हुआ है. What are the details that SRS gives you? But look at the NEET PG PYQ that came last time. Anybody can answer this one. What is the de facto method of census data collection? Information is collected based on what? So please remember there are two methods. Okay, de facto method and there is a de jure method. Okay, so you have a de facto method, yeah, and you have a de jure method. So earlier it was a de facto method, guys, location at the time of enumeration. Very good. Usual place of residence is de jure method. अभी current India का census, current census in India is de jure. It is also known as period census, not point census. It is known as period census. Earlier it was de facto, now it is de jure. And all of you should know census is under Ministry of Home Affairs. Home Affairs में दो चीजें हैं, guys, disaster as well as census. ठीक है? So this table you can go through later. I have written for you health information collection system का a little bit of points that you can go later in the PDF. We have already discussed, you don't have to worry about it. Okay, which of the following, coming to the last thing, last 10 minutes on the clock, which of the following health program does the logo represents? What is this, everybody? So this one is JSSK, जननी शिशु सुरक्षा कार्यक्रम, जिसमें सब कुछ फ्री है, प्लस इट इज ऑल्सो फॉर सिक इन्फेंट्स. दिस इज नॉट माँ प्रोग्राम इज ब्रेस्ट फीडिंग, हियर शी इज जस्ट हगिंग द बेबी. ठीक है, सो दिस इज जननी शिशु सुरक्षा कार्यक्रम वेयर एवरीथिंग इज प्रोवाइडेड फ्री. And also everyone, we included whom? We included the sick infants. Services are being provided to the sick infants. Now this is a combined logo. प्रधानमंत्री सुरक्षित मातृत्व अभियान का लोगो देख लो. 9th of every month free antenatal services are provided to women in second and third trimester. ये हो गया तुम्हारा लक्ष्य. This is Pradhan Mantri Matru Vandana Yojana, in which 5,000 is being given in 2 installments. Okay, 2 installments. This one is Suman. This one is Suman. So I'm going to ask you, even if it's not visible, just tell me. Increase institutional delivery. What is the program that focuses to increase institutional delivery? JSY, Janani Suraksha Yojana. Free services to pregnant and sick infants, JSSK, Janani Sishu Suraksha Karikram. Free screening 9th of every month, Pradhan Mantri Surakshit Matritva Abhiyan, ये वाला लोगो. लेबर रूम क्वालिटी हो गया, गाइस, लक्ष्य. ट्रेनिंग डॉक्टर्स इन इमीडिएट पोस्टपार्टम केयर, दक्षता. मैक्सिमम मोर्टैलिटी पोस्टपार्टम पीरियड में होते हैं. एंड ये सर्विस गारंटी स्कीम, जीरो टॉलरेंस, जीरो डिनायल ऑफ सर्विसेज, सुमन चार्टर, सुरक्षित मातृत्व आश्वासन. ओके, सो दिस इज अ समरी. ये सुमन के सर्विसेज देख के जाना एग्जाम में, गाइस, बिकॉज इट इज It was the first initiative that has included women up to 6 months. I want you to focus on this. एक तो इसका full form, it is आश्वासन, not अभियान, and it includes women up to 6 months post delivery, not 6 weeks. ठीक है? This is JS5 package. For JS5 package, you should know the ASHA as well as ASHA का urban area and rural area में you should know the package. ठीक है? This exam में question definitely terms up from JS5. Okay, this is child initiative programs where you should know about this one. Home based neonatal care, number of visits, कौन से day लग रहा है, 1, 3, 7, 14, 21, 28 and 42, and accordingly I have given to you. Rest you can go through once whenever you feel like, but राष्ट्रीय बाल स्वास्थ्य कार्यक्रम में 4 Ds है, याद रखना, इसमें TB और leprosy भी अभी screen होता है. Don't forget, congenital glaucoma is not being screened, okay? राष्ट्रीय बाल स्वास्थ्य कार्यक्रम, they are fond of asking that. All right, last couple of things. 65-year-old female comes to OPD due to hematuria, bladder cancer. तो bladder cancer में which of the following chemicals is associated with this? Vinyl chloride liver हो गया guys, benzene हो गया तुम्हारा leukemia. I only wanted to revise this D for bladder, so don't forget it. All right. In a nuclear family of husband, wife and 2 children, a new child is born. The period being considered extends from birth of the last child up to until the point where the first child leaves home. Birth of the last child to the point where the first child leaves home. This is your family cycle, okay? This is what? This is your family cycle. Formation क्या है? Marriage to birth of first child. Extension, birth of first child to birth of last child. Complete extension, birth of last child to first child leaves home. So over here, look over here. Birth of last child to first child leaves home. So what is the answer over here? It is nothing but complete extension. And अगर exam में सिर्फ इतना लिख के आ जाए ना guys, first child leaves home. So the first phase denotes each of the this thing. First phase denotes, like first part of the cycle denotes the cycle exactly. ठीक है, सो फैमिली साइकिल पढ़ के जाना है. ओके, लेट्स क्विकली डू अ कैलकुलेशन ऑन न्यूनेटल मोर्टेलिटी रेट. व्हाट्स योर आंसर ओवर हियर? सो रिमेंबर NMR, कोई भी चाइल्ड हेल्थ का फॉर्मूला होगा, मल्टीप्लायर इज 1000. हियर इट इज डेथ from 0 to 28 days per 1000 live births. So now यहाँ पे total births दिया हुआ है. Don't immediately take it as the denominator. 40, 50, 50 stillbirths है. So you have to subtract that. Don't forget. 50 neonates die within the first 7 days and this is 150. So this was very easy calculation. 200 by 4000 into 1000. This will be 50. ठीक है. Infant mortality rate also per 0 to 1 year है. Under 5 is also 0 to 1 year. And the most common cause for all of these is low birth weight as well as prematurity. ठीक है. Low birth weight as well as prematurity. Going to the next one, an unstable and emotional temporary social group with the leader. So अनस्टेबल है, इमोशनल है, लीडर है. ये लोग कौन है? जल्दी से बताओ, जल्दी से बताओ. वेरी गुड. अनस्टेबल, इमोशनल. वेरी गुड. हर्ड. ओके, सॉरी, नॉट हर्ट. व्हाई आर यू राइटिंग हर्ट? इमोशनल विद द लीडर. दिस इज अ मॉब. हर्ड क्या होता है? हर्ड इज अ टूरिस्ट गाइड. ओके, व्हाट इज अ हर्ड? हर्ड इज, इट इज unstable, it is temporary. Okay, it is temporary. It has a leader but no emotional connect, no emotional quotient. Okay, crowd में कोई leader नहीं होता. We gather out of curiosity. And band everybody is a permanent group. Okay, band is a permanent group. ये तीनों क्या है? These are all temporary. Yes, these are all temporary. Next one, a soldier presents with fever. This table was important, so revising it. Louse infection. Louse infection matlab, what are we going to talk about guys? Epidemic typhus. And what is the organism or rickettsial agent? कौन सा है epidemic typhus में? प्रवासी की है. ठीक है. So you should go through this table that I think I have, sorry, 2 बार ये question आ गया. ये वाला table है, इसको देख के exam में पक्का से जाना है guys. Epidemic typhus is Herpes rickettsia provaziki, this is your vector louse. Murine is endemic. Scrub typhus एक पूछता है. Orentia shutsugamushi trombiculate mite, that beautiful strawberry color. Okay. Q fever, remember, has no vector in human. And इसमें हम लोग क्या बनाते हैं? एस्कार फॉर्मेशन. ओके, देयर इज फॉर्मेशन ऑफ एस्कार. Alright, next one. Okay, now we are in the last things. Anybody can give me the answer to this? What type of error over here? A new drug designed to lower cholesterol level is being tested on 1,000 participants. Null hypothesis says that the new drug does not work. After analyzing the data, the researchers conclude that the drug doesn't work, but in reality, it has a small effect. So what is happening in reality, guys? In reality, drug actually अच्छा है. So in reality, H0 is false. Your drug is good. But when you did a clinical trial, but based on result of clinical trial, you could not show it. Based on result of clinical trial, H0 is accepted, which is this type of error, type 2 error. I hope you got this correct. Type 2 error is associated with the word false. H0 false but accepted. Type 1 error is associated with the word true. H0 true but rejected. And P value कितना होना चाहिए? Less than 0.05 to give significant results. This is the probability of committing a type 1 error. Let me finish up, then I will tell you once this. ठीक है? Let me just wrap up, then whatever doubt you have, I will explain to you. Ritika, give me a moment here. What is the answer to this? A pharmacist selects medicines, 3 categories. अब इसमें आप क्या देख रहे हो? 3 different categories have been formed. So what is this type of sampling, everybody? Stratified random sampling. When you have 3 different groups, so what do you do in a stratified random sampling? You have converted heterogeneous को किस में convert कर दिए हो? Homogeneous population. ठीक है? Systematic random sampling. See, this is systematic. In this, you will get the buzzword every 6th person or every nth person, every kth person is selected. And simple random sampling is always done for homogeneous populations. Clear? Cluster sampling आप करते हो immunization coverage के लिए 30/7. You can refer to the RRs once also. Now, last couple of mirror images on the clock. What is this child suffering from? This child is suffering from measles, everybody. Retroauricular in origin. A couple of things that come in exam I've given you. This is Koplik spot. Spot rash के पहले आता है. Comes before rash. Okay? Comes before rash. This one, area of inflammation, only for the images देख लो guys, chicken pox. This one over here, unilateral swelling of the parotid mumps. Mumps का सबसे common complication aseptic meningitis है. But if they say young adults, then orchitis and oophorytis. ये हो गया bull's neck. Okay, this is diphtheria, and we have also done the management of diphtheria. This one is Poshan Abhiyan. Just have a look at the logo. This is midday meal. Midday meal का नाम अब Poshan PM है. And one thing that you should expect from here, 1/3 calorie plus half of protein is what is being used. This is Poshan tracker, which is being used in Poshan Abhiyan. This is under Ministry of Women and Child Development. This is under Ministry of Education. Only wanted to share the logos. Yeah, this is the last question, guys. 3-year-old girl presented with difficulty in walking and bowing of legs. She was undernourished and had minimal exposure to sun. Which program deals with nutritional deficiency in children below 6 years? So when you have to talk about below 6 years, everybody, Anemia Mukh Bharat? Nahi, it's only for iron. Nutritional is a very broad term. PM portion is low birth weight, stunting and wasting. What is the answer here? This one. Because it gave you a hint of 0 to 6 years. ठीक है? ये है ICDS का logo. Again, this is under Ministry of Women and Child Development. This is under Kishori Shakti. This is Kishori Shakti Yojana. ठीक है? ICDS you should know. You should actually know the logo for ICDS. Couple of last minute logos. This is National Quality Assurance Program. इसमें ही तुम्हारा लक्ष्य आता है. This is mental health program ka logo. Level of implementation is the district, guys. This is National Iodine Deficiency Disorder Control Program. This one pellagra niacin deficiency wala image hai, and this one National Tobacco Control Program. ठीक है? Polished rice eaters thiamine, that is not thiamine, polished rice eaters, okay, you will see thiamine deficiency. Chronic alcoholics, you will see thiamine deficiency, okay. All right, applied nutrition program is under which this thing, UNICEF. So you can just go through this table, guys. United Nation, last thing hai, headquarter New York. All the organizations that start with the UN, New York mein hai. UNDP, New York. What they have done, you can refer here. UNICEF, New York. ILO, Geneva. Khana khane, we have to go to Rome. USAID, World Bank, this is Washington. Red Cross, again Geneva, that you should know. Ford Foundation, guys, both the foundations are in New York, ठीक है. Rockefeller Foundation also are in New York. CIDA आया हुआ है, TB assess करता है. Danida, blindness. Guys, what is the definition of blindness? Please remember, visual acuity less than 3/60 in better eye with available correction, okay, with available correction. This is according to the program, okay, this is according to the program. WHO बोलता है best possible correction, ठीक है. Colombo plan set up aims, okay. CARE again in Geneva, and it works for a lot of things. And these are the logos that you have done. World Health Day celebrated 7th of April. This is UNDP, this is United Nations. This over here is World Bank, okay. This is UNICEF. This is population control. This is FAO, Labor Organization, UNAIDS हो गया. This is International Red Cross, and please remember this one जो दिख रहा है ये सुरक्षा क्लिनिक है, okay, that is a foundation of NACP. Rest I have labeled the logos for you so that you don't end up making a mistake. Clear, everybody? And now honestly we are to the last question which I wanted to discuss was diarrhea. So can anyone tell me the answer to this one? A 2-year-old child came in the OPD with severe diarrhea, vomiting, deeply sunken eyes, no urine output. On examination, baby is dehydrated, lethargic. This is the case of severe dehydration. What do you do in severe dehydration? Normal saline नहीं देना है. Severe dehydration क्या करना है? Ringer lactate with 5% dextrose. So this chart you should refer to. Mild moderate degree of dehydration. Please go through this. They ask you, they will give you a बच्चा आया है, very sunken eyes, tears absent, mouth is dry. So what is it? Severe dehydration, okay. So you should know these things that I have given you in the table. Then all the rest, reduced urine output, markedly reduced in severe output. Then you have plan A, plan B, plan C. Plan A is home management. All you need to do is give extra fluid, give zinc tablets, ठीक है. Then you should know after every loose stool up to 2 years 50 to 100 ml देना, 2 years or more 100 to 200. But if it is mild to moderate dehydration, zinc tablet duration of diarrhea कम करता है, ठीक है. Moderate dehydration में you have to give ORS, and we all know 75 ml देना है first 4 hours. So this is how you should know. That is, yeah, pediatrics you can refer to once pediatrics. More important जो question आता है ना guys, वो severe से है. So severe में please remember we are giving ringer lactate, okay, 30 ml per kg and 70 ml per kg. For infants under 12 months, 1 hour में 30 देना, and after that 4 hours में you have to give 70, but 12 months to 5 years 30 minutes and 2.5 hours. So I just wanted to revise what is plan A, plan B, plan C, and how do you classify mild, moderate and severe. Okay, so this sums up our sessions, guys. Before I go, just give me 1 second. I had to tell you something. Just give me 1 moment, please, everybody. 1 second, रुको. Okay, before I go, okay, some latest values. What is the current CBR of India? 18.4, okay, per 1000 mid-year population. What is the current CDR of India? 6.4 per thousand mid-year population. What is IMR of India? 25 per thousand live births. ठीक है? What is MMR अभी? Around 88 per 1 lakh live births. Okay, remember these little values which I have given you, and TFR मैंने already बता दिया था, it is 1.9. Okay, best indicator of health status, अगर कभी भी आया health status, best indicator it is IMR. But socio-economic development अगर आता है guys, it is under 5 mortality rate. UN word हो गया, under 5 mortality. Availability utilization, effectiveness of services, it is infant mortality. Combined obstetrics pediatrics care, it is perinatal mortality. ठीक है? TB का सर्वेलेंस सब होता है. ओके, TB वी आर गोइंग लुकिंग फॉर केसेस हाउस टू हाउस, हॉस्पिटल रिपोर्टिंग भी हो रहा है, एंड इन TB यू ऑल्सो हैव इंटेंसिफाइड केस फाइंडिंग. ओके, so thank you so much everybody. Just 1 minute talk to all of you. No matter how hard it gets, never give up guys. This PSM LRR ka PDF will be shared. You will not miss out any point from this LRR PDF. Along with this, you should definitely in these last couple of days do your PYQs very nicely guys, and I will always ask you in classes, in lectures, everywhere I have told you guys, PYQ तुमने नीट PG भी करनी है. Please go through नीट PG PYQ at least last 3 to 5 years, and FMG PYQ करना ही है. Remember this is a phase. It's not that this is only life. Okay, it's a transition. You have to go from one phase to other in your life. Okay, once upon a time we all were students. Now we have a family. We have other things to do. Same you will also have, but abhi this is the time when you have to put in your best guys. This is the time when, remember that last couple of days is the time जब अगर मैंने अच्छे से कर लिया, you will get through the exam. Just keep revising, be consistent, don't waste time. Practice your PYQs. नीट PG के पेपर्स देख के ज़रूर जाना. Give GT. We have our pulse test also. Please give GTs. It is very very important. You can give on the PrepLadder app your GT. That is extremely important. It will, and don't get emotional after seeing your GT score. ठीक है? बाकी पढ़ते रहो, खुश रहो, be happy, keep smiling, and everything will fall into place. Okay, I will share the PDF after the session. Thank you so much. God bless you all. Bye bye. Take care.